Make sure we hear ourselves. Because we can hear ourselves. Dr. Hart can hear us.
Okay, good morning, everybody. What a pleasure it is to see everybody. I'm gonna go ahead and call this meeting to order. It's our strategic plan. I think we have kind of just one thing on the agenda, which is the strategic plan. What I would ask if you are sitting at the table, if you can go ahead and turn your microphones on, make sure they're green. Couture says we've got Dr. Hart and perhaps Dr. Patton online. And so if you can kind of hear us in the room, then they can hear us online. So that's the instructions I was given. So I guess the only thing we need to do is adopt the agenda, and then we'll kind of turn it over to staff. So do I hear a motion?
Second.
A motion and a second to approve the agenda. All those in favor say aye.
Aye.
Any opposed? That motion's unanimous. If we could just have the clerk go ahead and take a roll call, so we have who's here for the record and who's online. Madam Clerk?
Thank you. Chair Ken Cornell,
Here.
Vice Chair Cheryl Twombly, Treasurer Dr. Maggie Labarda,
Here.
Member Tina Surton, Member Mary Chance, Dr. Nancy Hart, calling at the moment, so I'm sure she'll be here in a moment. Member Dr. Kamala Patton, Member Lee Pinkeson,
Here.
Honorable Judge Wilson Bullard.
Okay, so we've got a quorum of 6 here. We'll have some others joining us online. Just to kind of frame this real quick, and then I'll turn it over to Marcia. So we are in the midst of trying to implement our strategic plan. And we spent a lot of time and effort doing that. And so one of the things at the end was, let's make sure that we update that process once we get through a budget cycle. And so I think that's what today serves as, is our strategic plan update. We've got some amazing people that are gonna kind of be the orchestrators of this event, and hopefully we can get our thoughts out on the table and into the plan. And with that, Steiner, you're recognized.
Well, good morning, everyone, and thank you all for being here. I am excited about the work that we will be doing today. We are going to be led by Miss Conchita Robinson and her team. I am going to allow Conchita to tell you a little bit about herself and her team, but I would like to let you all know that I saw them in action with FACT. They are helping FACT with their strategic plan, and I was really impressed with the work that we were able to do in a short amount of time. And so when I reached out, they said, for you, we will come to Alachua County.
Right.
They have literally been around the world and back again. They are busy and booked. And so I want to publicly say thank you, ladies, for the work that you were able to do, for making all of the interviews happen. I understand they were able to meet with everybody again in a short amount of time so that we could all be here today. So thank you, thank you, thank you. And with that, I will turn it over to Conchita and to get started, or Jackie. My miss. Okay, so if you all will remember, I think it was Maggie
And Mary.
and Mary, okay, who talked about the fact that we probably should have a discussion about the life cycle of nonprofits. And we were able to reach out to Teresa, Dr. Teresa Beachy, with our own Center for Nonprofit Excellence, and asked Teresa if she would come and just walk us through the life cycle. So Teresa's going to do that, and then we'll turn it over to Conchita and the team. You see, Marcia's not looking at the agenda.
Well, good morning, and thanks for the invite. It's a perfect time to talk about this as we are promoting this as a way to strategic nonprofit partners. And I know that some of you have already heard this week from Dr. Labarda, and Mary and Maggie and I and Tracy, who's on Mary's staff, have been really engaged in this process with our local partners. And it's a exciting way to not only look at how we can help nonprofits build capacity, but have some common language for our funders and our community in terms of what we're actually seeing with our nonprofit. So I think we have a slide. That going? Excellent. And then do I just tell you to forward the slides or? Oh, perfect. So the Nonprofit Life Cycles Institute, which is a national institute, has developed this process and has been promoting it now for about a decade and a half. And what they're really looking at is a way, again, to give some common language around where a nonprofit is in terms of their readiness, their capacity in order to do the work that they're doing around their mission. One of the things that you'll notice is in this presentation, there are a lot of language points that revolve around diversity, equity, because that has been, for the last decade, a real big point in a lot of nonprofit world work. And they are in the process of actually adjusting some of that. So for those of us who are in states where funding is kind of yeah, hostile to that. Thank you for that word, Maggie. Then we can continue to use the instrument without having to worry about there being red flags for folks. So the Nonprofit Institute, again, is looking where they want to see nonprofits thrive. They want to see nonprofits win. And they know that there is this kind of work that's happening collectively between the nonprofits, their funders, consultants, and then what that means for the ecosystem and the capacity that a community has to really make collective impact. And why this particular project is so effective is I think that it uses very simple language when we're talking about how a nonprofit can assess where they are and what it is that they need to work on. We have historically used a lot of very business-oriented programming like the SWOT analysis and things like that that can be very onerous for a nonprofit, especially when they're in a startup phase. And so this table illustration is one of the things that really drew me to this because it's very evocative of what you're seeing in a nonprofit. Their mission being upfront, that's what everyone knows them for. The programs upholding that mission and ensuring that it's stable. And then the 4 pillars of what they need operationally to ensure that mission and those programs are thriving. Their management operations, their governance model, what the business model is. And believe me, nonprofit is a tax status, not a business model. And then administrative systems and how they're managing themselves as an organization. They've also done a great job in this model of using language that we're familiar with from a psychoeducational standpoint. This nonprofit life cycle is very similar to a traditional life cycle that we think of for ourselves. And so again, it kind of breaks some of the barriers that nonprofits have in thinking about their planning. So what the benefits are, again, it's shared vocabulary. You understand that it's normal and that you're not alone in where you are and some of the issues that you're dealing with operationally. Gives them a way to really clearly communicate what they need and where they are in the process. And it depersonalizes it. So it's like these structural challenges are something that everybody faces and that there are actual strategies to build that capacity and sustainability. And it's not just a personality issue or leadership dependent, which I think a lot of times we see in nonprofits as a myth. So these are the stages that they have developed and have researched over time that, they go from idea to startup to growth to maturity, organizations that are in decline, that are in turnaround, or that are becoming terminal. And really where we see the majority of organizations that are funded through the CTAC and even our CAP programs locally is folks that are in startup and growth. We are lucky that we have a lot of mature organizations in our community as well, but that's where we're going to see a lot of the work needing to be done for our organizations. So I'm just going to go through, because we have so little time here, I just want to talk a little bit about those two phases then, the startup phase. This is where organizations really are starting to get their operations a little more codified. So their programs are simple, they're experimenting, they're trying to figure out what's worked. They have a lot more breadth than depth, right? They think they can do it all, but they really haven't started to build the infrastructure there. Their management, this is usually the founder of the organization is still leading the process. They're likely the most experienced person that they have, so they're bringing in a lot of new staff and trying to build the capacity for what they're doing. Their governance model, this is again, usually the people that the founder has brought on board to start, right? So it's a lot of people with personal connections. They may not have the skill sets that you would like to see on a traditional board of directors. Their business model, it's pretty low budget. Again, it's that whole bootstrap operation sort of scenario where they're not really funded in a way that they can start growing. And they're not doing a lot of the operational pieces that we would expect in a mature organization. And then there's systems, again, generally weak. These are the folks that are having difficulty getting their invoices in, managing the data to give you the deliverables reports. So the challenges here is that they really are trying to share their vision and their organizational responsibility with the board, with their stakeholders in the community, trying to hire versatile staff. They're leveraging that sweat equity, trying to live within the financial means because their budget's pretty low, and then trying to replicate the same kind of staff and board members that they need. Growth organizations are a little bit further along then in their journey here, and their program opportunity and service demands are definitely there, but they're starting to exceed their current systems. So these are the people that maybe had been doing the work for a while when the CTAC contract came along, and suddenly they have an infusion of financial resources and opportunities, but they don't have the structure to really manage that, where they're like, oh my gosh, we just tripled our budget and I don't have a bookkeeper that can do this. I don't understand how, what does this mean for our audit threshold? What does this mean for our data management system? And so really, these are the folks that are trying to figure out how their programs are organized and what that actually means for their capacity to expand and achieve their mission. The management, this is where they've really started to maybe train and hire people with certain skill sets that aren't just in the program area, but they're starting to get some experts in for finance, for HR, those kinds of things. Their governance structure, again, that structure starts to appear. Maybe now they have committees. Maybe they've actually made a targeted and intentional approach on how they're recruiting board members. Their business model, they've diversified some income, but that means that they have to have greater accounting and compliance complexities. And again, whether or not they're actually looking at how they're spending those resources locally and what that means for their organization. And then their current systems, again, a lot of times we're building it as we go. And that is a difficult place to be in, especially when you are talking about an organization that maybe the executive is still wearing all of those multiple hats. And so then how do you meet the demands of the funder that you're working with, the program, the increased capacity for participants? All of that becomes a difficulty. But the challenges, again, are often positive that the organization sees, where there's a lot to do but not enough time. They're identifying some real competence that they have in working toward their mission. They're beginning to formalize their organizational structures. They're creating some programs and even doing some strategic planning at this point. And they're starting to become a lot more comfortable with the pace and the change that are necessary in order to get where they want to go. And then again, we have a few of the organizations that are being funded locally that really are in this mature space, where they have this reputation of being really excellent at the work that they're doing, really making impact, that they can show that impact. That they're operating with that solid organizational foundation. These are the organizations that when you walk in, the environment tells you this is a business model that is sustainable and that people here know what they're doing and the participants that are coming feel good about the services that they're getting. The board is all speaking with one voice. Their systems are apparent. And so, when we fund these kinds of organizations, we're able to do more high level work. We really are creating capacity in a different way because they're able to have a much more forward focused vision of what their organization could be with additional resources. And then hopefully we don't have very many that are in decline, turnaround, and terminal, although we could probably name them locally if we really wanted to. And then part of what happens with this particular process is that there's an opportunity for the stakeholders with that organization to do a selfie. And that really gives a lot of input on where that organization is so that they can start to plot where they are on that life cycle graph. And I know that Maggie is currently working with Repurpose Project to do this. They just completed their selfie. Getting the board members and the stakeholders to complete that, I think we sent it out to about 60 and ended up with 17 responses. So, it's kind of an onerous process. So we're actually working with Melanie Meintros at the Leadership Institute. I know Tracy's been working with her very closely to remove the DEI language so that it's more accessible to all of us, but also just the information that we're getting back from those selfie assessments. And if there are ways that we can make it more accessible for people so that they're more likely to complete it. But what that allows them to do then is that they start to see that this is diagnostic. And so it's a way to look at your organization. It doesn't determine that these are the things you have to do, but it really gives you opportunities to build your strategic plan, to build your structure so that this is going to again, uphold that table that we saw at the very beginning. It also emphasizes that this is not size or age dependent. There are organizations that are 30 years old in this community that are still in startup mode. Because they've just never taken the time to do the planning on the board part, on the administration part, on their systems part to really get where they need to do. They're great at programming. All the other stuff, not so much, right? And it also isn't determined about if you are an all volunteer or if you're a paid group. There are volunteer groups that are rocking it and are really in growth mode because they've got the systems in place using a business model that's really effective. But again, it allows them to ask questions in those 4 pillars that are most critical to their capacity and long-term sustainability. What stage are your programs in individually, collectively? Does your current leader have the required characteristics to take you to the next stage? Is the board assuming roles and responsibilities that are really consistent with where you want to go? Where are your systems? Are they in line with the program? Do you have the expertise that you need? And then is there a business model there that's consistent with where you are as an organization? If you're still using, a 15-hour-a-week bookkeeper and trying to manage, it's probably not where you need to be in managing contracts. Right. So thinking about where you're investing funds and how we can help them support that capacity for operations. And so again, the Institute is kind of there to help us work with organizations to build their capacity. I'm very excited because the members in the nonprofit community that I've worked with and that we've exposed this model to are really jazzed about how this can work for their organizations in a very different way than past models of strategic planning has worked. And I think from a community funder standpoint, it can really give you information about when you're doing a contract and you have an organization that is clearly in startup mode based on where their systems and business model and all that is, what you can really anticipate from them in being able to produce and being able to meet deliverables and invoicing. And is there then a runway for capacity that you need to be thinking about funding rather than starting from day one in being able to meet those deliverables versus an organization that is mature who can hit the ground running from day one, and what that means for the contract in terms of, well, where can we help you expand your capacity? Maybe it is marketing. Maybe it is building some infrastructure with technology and things like that that will allow you to take your programs to the next level because all of the infrastructure to uphold that is already there. So I'll have a couple of minutes for questions if you have any. Yeah,
Could you go back to the table slide?
yes.
I just wanted to share that the reason the Consortium of Florida Education Foundations, that this made sense to us is we had a business model, 30 years of history, lots of systems and ways of doing things. And then we had a outsized $21 million opportunity come our way that had to be spent in short time and involved contracts to 50, analogous, I think, to the trust, 50 ed foundations around the state for a new body of work with new ways of doing things. $100 a month. And I had a $300 a month bookkeeper in Orlando. And I was drawing down funds within a state system that had to be drawn down with the backup. And we were going through thousands of pages of backup every month. So those of us who'd been there for a while thought, we're good. We got this. And then some newer staff who we brought in were like, really? Do we have this? So we had to look at it for ourselves as an organization, and it did help depersonalize it for us. Because if we might think, okay, we're super strong, we got all the money in the world, and we have good management, but it was systems and governance that we had to rethink. And because if one of those legs is wobbly, the mission falls off the table. And so a lot of us go to our strengths, and it might be programs, might be business model, and you kind of put off the other stuff. But it became apparent for us, but more so it became apparent for the 50 recipients. So it was a both and. So I would encourage us to think about it from the trust perspective and from the providers that the trust funds perspective, because it's important for both.
Absolutely. And I think that's the great thing about this model is that it fits organizations of all type and all size. And it really does give you kind of those basic structures to think about if our mission is this and we have these programs to focus that and make the impact, unless we're really dealing with those 4 pillars effectively across the spectrum of our work, it's going to fail. It's going to fail.
Yeah, and I'd like to add that I think as you look at this, there are some stages that are more expensive than others. And if we're going to support organizations that are in startup and growth, then we need to think about not just what we expect. So the contract might need to look different in terms of the deliverables, not the deliverables in terms of program, but the deliverables in terms of that data capacity and that invoicing capacity. But also we need to be prepared to help them with that infrastructure capacity, right? So if they don't have a good, I've brought up, can we just get them QuickBooks sometimes, right?
Right.
And we need to think about what funding their infrastructure and thinking about the fact that we have to build up their admin systems, not just because we've built up, it's the same scenario that Mary just described. There are organizations in the community that have been sort of eking along financially to do some kind of cool programming, but now can't handle the kind of money that they're getting and don't even know how to get money from anywhere else, as we talk about, which is an issue I think we need to discuss today. But they don't have it. And so we need to help them invest in that, knowing that there's going to be a difference in admin rate for some of our startups, growth organizations than our more mature organizations that have been able to spread their admin costs and have a lot of that infrastructure already built in. And I think this model helps understand why that is and how that will play out as we contract with different. Mary's done this with more groups than I have. I've now got 3 that I've gone through this process with, and it's always different, but the conversation becomes much more focused on, oh, we didn't know we needed to have that, or, oh, yeah, let's focus on this area or another. So it's been a really useful. I have said, I wish to God when I inherited an organization of $25 million and 300 and some staff that was sort of in decline that I had known about this model, because it would have meant a lot less sleepless nights for me if I'd had it would have shown me a different path forward than the trial and error one that I.
Well, and to your point, Maggie, the other thing is when you're funding mature organizations, their investment from you may be more suited to their business model. So if they've got the staffing, they've got the programs in place, but what they really need to do is grow their development and marketing and awareness, because that will allow them to diversify their revenue in a way that they haven't been able to do before. That's an investment you're making in the organization and the community as a whole. And I think funders haven't always looked at it that way. It's like, oh, that's overhead. You know, we can't fund that. And it's like, if you think about that as capacity building for their model, you know, that's a tremendous asset that you can do, because that's long-term sustainability by helping them build a brand, helping them build a department that can continue to raise money beyond the investment that you've made.
And I
So-
think we
oh,
can
go
think
ahead.
about it in terms of leveraging. If it's a mature organization, we're in a position to leverage what they already do. If it's not, then we're in a position to make them able to do.
Correct. And our fundraising conference that's coming up on August 29th is all about sustainability. So we're doing the entire, you know, how to raise more money, how to keep it stable, and then how to diversify that income. So we're really focusing on that because we know that that's been a funder priority in the community. We don't want people dependent, because as we see the landscape changing of how state and federal funding is being allocated and becoming available, people have to be creative in how to do that. And unless you have a business model that focuses on that, you're going to miss the boat. So we do have the books. The presentation, I think, includes all of the information about the website, so you can go there and see the entire process a little more thoroughly. If you have any questions, you've got multiple experts on your team as well as in the community that can answer those for you. And of course, I'm always happy to be a resource as needed. So, yeah, Ina.
For this, very helpful, Teresa. You said the resources online, are they outside of, in the public view, or are they behind a paywall?
A lot of the useful resources in terms of what you can actually teach and all of that is behind the paywall, but all of the information about the research and how they got here is definitely available forward facing.
And the book's a short read and it's on Amazon.
Yeah, it's a very short read. It's got lots of pictures and big print. Which is great because I can usually only read on a Kindle. So, all right, thank you.
Good morning. Thank you so much. That was a great presentation and a good reminder, and definitely important for the process that we are about to embark on today. My name is Conchita Robinson. I'm the president and principal consultant for C. Robinson Associates. I'll share with you a little bit about my background, and then I will turn it over to my team to begin the process. Do you see it here, Todd? My background is a little different. I spent the first 20 years of my career with the IBM Corporation. I've been moving all around the United States. And my last job with IBM was running IBM.com for the US. Leadership is what I love. Business is what I do. I left there and went to do a consulting job for Spencer Stewart, executive recruiting, when my mother had a stroke in 2000, because I needed to now get off of the road and handle some family business. And I stopped in 2000 and began to do that work. And then 9/11 happened, no more war for Talon, if you all can remember that time. And I then took a sabbatical for about a year, focused on family. And then I started a firm, C. Robinson Associates. And it was really starting out as a one-man. I could see myself in the presentation that you were going through, even though it wasn't a nonprofit, still going through some of the same steps. But started out as executive advisement, executive coaching, advisory services, leadership development, and those kinds of things. We've been in business for about 20 years now. Last year, an office in Florida, Georgia, and Ohio. I grew up in Jacksonville, Florida, so not far down the road. Today, we do retreats for board and staff. We do team building, effectiveness kind of work, strategic planning. But following that, we also do checkups and accountability based on what comes out of some of the retreat work. We do organizational assessments and also organizational development work, professional development work, coaching, advisory services, and curriculum development and training and development. I must start again by saying thank you for the opportunity to assist you with your strategic planning process. As each of you know, because you've done this probably many times before with many organizations, it's a journey. And for us, walking with you in this journey, it started with us having to learn a little bit about the organization through talking with Marcia and her leadership team. But then, hearing from each of you to understand, what your visions were, what your strengths were, your challenges, and what's successful. And I would tell you that nonprofit life model, there are business models that look the same way that kind of tell you that you need to do a man in the mirror kind of thing and look at where you are and make sure you reinvent yourself at the right time so you don't end up in that place where you're declining and terminating. So there were things that, of course, we learned from that say, understand those that we fund. But I think there are things that we can learn from that say, where are we as an organization? Where is the Children's Trust of Alachua County today as an organization? Up here is the mature, and how might we tweak or reinvent to ensure that we're starting back over with the cycle and growing again so that you end up continuing the cycle of success. So we are excited about the work we're going to do today. Marcia continues to tell me that this is the beginning of this work and that we hope that it's something that we can continue to assist the staff with once we get the direction from each and every one of you on the board and in the community. I want to pass this over now to Regine Denis on my team. Regine and Jackie are going to do most of the heavy lifting today. I'm going to be supporting them and assisting with the process. Regine?
Thank you. Well, you've already met Conchita. I'm Regine Denis, and I've talked to all of you. So it feels like home. I am a licensed social worker. I like to tell people I had 3 distinct careers. I started my career in New York City, originally from Queens, New York. And I work with children and families. I did everything from foster care, early intervention, you name it. Worked in a skilled nursing facility for children. And of course, then I was going to change the world. I was going to fix every child and family in New York. Well, powerful goal, right? I moved to Atlanta, Georgia, and I went to the other end of the spectrum. I realized that the children probably were outnumbering me. And I worked with geriatrics for about 20 years. And there I did it all. I did senior centers, active living, senior centers, home-based meals and personal care and homemaking, the elderly INA, information and assistance, did it all, thought I was going to fix all the seniors there. And while I was fixing all the seniors, I met Conchita Robinson, who was helping me really build a stronger team. I had great team members, but I was not as strategic as I was promoting them, and I needed some development. And so I got involved with C. Robinson Associates. They helped me maximize my team, and then they borrowed me for a few jobs. And now the last 17 years I've been with C. Robinson Associates, really helping others do what I couldn't do. And so I'm really excited about this because social services is my heart. That's where I really love being. And so whenever I can help strengthen other agencies, I find myself reinvigorated. So I'm really happy to be here. I think we're going to have a lot of activities. We are here just to facilitate, guide you through what you already know. And I'm joined by
too have had a long and actually enjoyable career. I started my career with a sustainable forest product company called the Weyerhaeuser Company. I keep forgetting about the mic. And really learned a lot during my time there. Weyerhaeuser was very results oriented, really took ingrained in us the importance of planning. So I took away from that how important planning and how important producing is. I then decided to take a different path. I decided that I wanted to do public sector work. So I went back to school, got my master's in public administration, and switched paths. I have worked on the municipal level for several years, worked for Mayor Austin in Jacksonville under his regime. And I also worked for Mayor John Delaney. Mayor Austin, I did training and development, chief of training and development, and under Mayor Delaney, I was chief of procurement. So I have kind of had a varied career. We did a lot under Mayor Delaney. We went for the Governor Sterling Award. We did a lot of work as it related to the efficiencies of the organization. So understand that and know how important that is as well. I then shifted again a few years later and went into transit and transportation. So in 2018, that's where I retired from. In transit, I served as chief of staff, chief administrative officer, and vice president of external affairs. So I've had a well-rounded career, have loved what I have done in every capacity. Then in 2020, I joined C. Robinson Associates. I met Conchita at my transit organization, JTA in Jacksonville. And Conchita was actually a consultant for us. And loved the way she worked, loved what she produced, but told her at one point, I will never work for you. And I think because I said that, she was determined that I was going to come on board at some point. So here I am, having a great time doing things like we're doing here today, working with wonderful people like yourselves, and just looking forward to spending time with you today here and getting some work done on updating and refreshing your strategic plan. So with that, okay. Yes, you're going to talk about the agenda. And what you're going to find is Regine and I are going to go back and forth. Now, you remember on the interviews, Regine said she was
I'm the
thank
quiet
you,
one.
Lee. But we know that she wasn't, right? And this is what's going to happen today. We're going to go back and forth.
Absolutely. So our agenda is pretty basic, 6 basic things, but you're going to do a lot of work. So we're going to tell you when you need breaks, just tell us, hey, break time. We didn't put any breaks in there because you're going to know when you need it and so forth. So we just gonna drill along. We only have 18 slides, so it's not a whole lot of information. It is just to give everybody a background of where we are now and who we are now, and then what we're going to tackle. And we're flexible, we can shift, because this is about really refreshing your strategic plan. So we've already done some of the introductions, and now we're moving into who we are today. We took the liberty of sort of doing a preliminary SWOT assessment, but we're going to add to that anything that's missing, take out anything you don't particularly feel is correct. We're going to do a little envisioning exercise. I'm a social worker. I like to have you get comfortable and really see yourself in 3 years, because if we don't see it, it's really hard to get to it. Then we're going to prioritize some of the things that we've heard and we've read. We've taken the liberty of putting some in of the things we've heard, and then we'll add to that. And then you all have dots. You're going to prioritize and see how we can really set the stage of what we're seeing, what we're envisioning in 3 years. Then we'll do a little brainstorming, talk about funding, how that's going to look in the next 3 years. Some discussions and planning and timelines, really guiding the staff where they need to be, who needs to own what, how we're going to move the ball, and then sort of wrap up. Now, it's a strategic plan, so it's not going to be built in one day, but it's a work in progress. We're really going to get our vision out there of what we need and how to begin to fill that in. So to get us started, we wanted to refresh everyone, which I know everybody in this room really knows these well, but for the benefit of those that are online and joining us, just setting the stage. So the Children's Trust of Alachua County funds and supports a coordinated system of community service that allows all youth and their families to thrive. So that's the mission. And then your vision is to facilitate equitable access and opportunities for all children, youth, and families in Alachua County to ensure every child reaches their maximum potential. So just as the stage to talk about who we are, we're going to go through your core values, and Jackie's going to take us through those.
Yes, say too, this is really, we know this, we know why. We really want you to take the opportunity to internalize this. So keep everything that we're talking about now in mind so that when we start the planning process, all of this information starts flowing back and you're really seeing where you want to go in terms of this. Now you have 10 guiding principles, and a lot of organizations call these core values. One and the same. I use the term same way. But it was very interesting in looking at your guiding principles because they're very specific. And they really tell you how your initiatives how you should approach your initiatives, how you should approach your funding. So it gives you a lot of information. So I just really want to take the time. I know you can read, but I want to take the time to pull out a few key words and a few key phrases in these guiding principles, because I want you to remember those and internalize those as we move forward. So your first guiding principles really talk about your initiatives and the fact that your initiatives are for youth and children up to 18 years of age, but it also talks about that your initiative should be supportive to those folks who need additional help and place-based support for those who have the greatest needs. Now, I thought, well, what are we talking about when we say place-based support? But we know that we're talking about networking. We're talking about people working together, bringing those organizations in that can help you get to where you need to go for those that are have the greatest needs. Then it talks about being collaborative. And we heard that word a lot in our interviews with you. As we talk to people, we heard collaboration and partnership a lot, and we're going to talk more about that a little later, and you're going to hear it a lot from us today as well. Then it talks about your initiatives should have impact. And we just heard Teresa talk about impact being a key to a growing and mature organization. So we want to talk, you're going to see that word a lot today too. And then your initiatives should be measurable. And have to measure in order to know what impact you're having. So are we measuring the right thing, number one? And number two, do we have smart measurements? Are we looking at those measurements in the right way? We looked at your indicators, your core indicators. Are they the right ones? Do we still need those same core indicators that we have now to take us into the future? We're going to be thinking about those kind of things. And your initiatives must be aligned with documented gaps or needs. And I'm sure as a board, you know where those gaps and those needs are. We know that you have recently had an assessment on literacy. We've heard from several of you that that is a gap in this community. Oh. Okay, okay, okay. And then it talks about your guiding principles, also tells you how your funds should be invested. Your funds will be invested and how they should be prioritized based on the highest educational, social, or emotional outcome value. So when I said specific, you really got specific in these guiding principles. Your initiatives will be evaluated. We don't have any problem with that. We know you do an open, transparent, and competitive evaluations when you do your initiatives. You put things out for bid using the RFP process. So we've seen that. Number 8, funding again. You will fund partners in a way that rewards efficiencies, takes advantages of economies of scales, and maximize service to your children and your youth. And here, as I heard Teresa talk, I thought about when she talked about those mature organizations that really look at this and have efficiencies and really can take advantage of economies of scale and probably have more impact. And then number 9, equitable access to services. You all may remember we asked you a question about that. And so it's going to be, we're going to share that result with you a little later. So that would be interesting as well. Then prior to any funding decision, the direct impact on children and youth must be a priority consideration. There's our word again, impact. So, as Regine said, we really are reminding you. So, next slide. You have 3 major goals, 3 pillars: health, education, about children thriving, and then safety. And in those 3 goals, you have focus areas. I'm not going to read them to you. You can see them there. You know them already. So, but just take a minute to look at each of the focus areas under your 3 goals. And then, as Regine and I were preparing, I kept asking Regine, well, is this 4th one a goal? Because every time we saw the goals, we also saw it followed by community capacity building and your resource centers. So we know those are important to you. We understand that. You don't have it listed as a goal, but should it be? No, you tell us. And under that capacity building focus, you have training for both communities, the community and your providers. You talked about many grants. And even we heard some on the interviews about maybe we should really look at kind of separating those grants from mini grants to another term. Maybe we have some type of startup. Heard Teresa talk about startups and growth companies that maybe can't provide the same efficiencies and that the startup that the mature organizations can. And then nonprofit excellence. So just a reminder of where we are with your goals. Under those same goals, these are your core indicators, that these are what you are measuring in order to determine your impact. Are these right? Have we really been measuring all of these? How do we know in each of these indicators that we're making an impact? Are we doing some of them and but not all? They remain there as we look at the future. 4th, find any indicators. Should there be? The little circle there, right of each of those goals, is the level of funding goal allocated. So first goal, health, 50%. 5, safety 10. Talk a little bit more about funding a little later. Are those the right levels?
I am really struck by, Regine, you talked about wanting to save all the children and I'm just wondering, you know, we're in the initial strategic process, but maybe we thought we were gonna save all the children in Alachua. Wrote that plan and now it's a little closer to reality and seeing looking at it from the life cycle lens and capacity lens, it's just interesting. Nothing in the guiding principles about capacity or sustainability. Start now, if that would show up.
So, I'll comment, on that specific point. I don't think we ever had resource centers on. That's, from my perspective, we put 5% in capacity building, really for innovative ideas. Also to build those new and growth companies into mature on administrative things.
So Ken, then are you saying that it should be moved over to one of the other goals? Is that what I'm hearing?
Well, when I see resource centers, I go back to our guiding principle number 1,
Uh-huh,
which ends with place-based. And that's where those services are delivered. We take them to where the people are.
right.
Don't really view, I mean, from a resource centers, you could cross all 3 of these. But that's a specific comment. If I could back up just a minute, one thing that really struck me as I'm re-reviewing this is that we have in our mission this word coordinated systems. And we've talked a lot about collaboration. And as one of the original trust members, what I can remember sitting at the dais that first budget season, thinking, what are we doing? And we said, let's fund everybody as much as we can. That was kind of a throw it all up against the wall. With the idea, though, that over time, the best and the brightest would rise to the top. And that focus our funding in the, I feel like where we are as a trust, halfway through the 12 cycle, that we really should be focusing on this, our mission, this coordinated system, collaboration. And we know in each of these 3 areas, health, education, and safety, who the best and the brightest in our community are that are providing those services. And what struck me with what Teresa presented is second part of that curve, which is terminal and declining.
Yes.
We need, in my opinion, as the coordinator of all the services, we need to be saying to those small organizations or those organizations that are not effective, or they have 1 or maybe in many cases 2 or 3 wobbly legs. If you don't attach yourself to somebody that's successful, we're not going to continue to fund you. And that's a really tough thing for us as a body to say. Lee kind of hit it at our last business cycle. That's where I feel like we have to, I hope today we make some really kind of tough decisions but not for those decisions. I believe in 3 or 4 years, we're going to be on the terminal side because we're not going to we're not going to be able to say to the community, we are moving the dial on that literacy. I mean, I think that their moment from now to 3 years from now is So I'm ready to identify with our staff's help or have our staff help us identify coordinated system in our mission. Who are the top in these three areas? And how can we ask them to help bring other providers into that coordinated system for that?
So the challenge with that, I think, and I agree with you, I never saw that fourth area as the resource centers. It was, to me, it was how do we fund capacity?
stuff.
Yeah,
And capacity.
capacity across. So if you look at the nonprofit sector and just the information comes out of the community foundation and understanding of more nonprofits per capita in this area than any other county in the state other than Leon or other city. Yeah. And what you heard from Teresa is actually also accurate. We have most of the ones that are trust funded are either startup or growth. And part of the challenge to collaboration and that kind of coordinated system that we are ideally aiming for is that when you're in idea, startup, and growth, I think you are absolutely unique. No one else does it, and they certainly don't do it as well. And your whole focus is on the programs. And a lot of these organizations, we need to take ownership of the fact that they got started and felt like they could get started because suddenly there was this pot of money that had never been available. And these are a lot of grassroots organizations that felt like they were doing significant work in their local community and are very proud of that work. And now they're funded. And so while I agree with you, Ken, that in a lot of situations, those organizations might be better off and the impact might be broader if they collaborated, merged, affiliated, whatever. It's going to be hard to get. But it's going to be very difficult. And they're going to feel very much like, well, this isn't what I signed up for when I supported the trust and its funding. And I think we need to be cognizant of the fact that we created this problem by putting out funding and just saying, and not understanding that ideas, startup, and growth weren't going to be able to compete in that impact world with those established, mature organizations. I think we have to find some way of addressing the fact that to some extent we're responsible for the problem that we now face. And I think that what we need to help our nonprofits partially understand is that they face three challenges. And I think so do we. We'll face it come 6 more years. Is, are we relevant? Are we really making an impact? And are we sustainable?
That means, am I talking loud?
Your mic's on.
Okay, yeah, I probably was holding it. And we know that when we're talking about results-based accountability, we're talking about a concept that measures how much, how well, everybody better off. Yeah. So as we talk about these indicators, I need you to keep that in mind too, because you said in your strategic plan that this was how you were going to approach measurements.
About the indicators. When we first started, and Maggie, you're absolutely correct, you know, although I wasn't on the board, I was in the audience. You know, what happened was the charter was approved, money started coming in and starting to accumulate a fair amount of money, and it was just sitting pressure for the people on the board to do something with that vector at that time. Started, so there was no real, there weren't policies in place. It was a situation. Problem with that was it really did create some problems, and it really for a while it hurt the board because it started to get policies and whatnot in place. RFP process, when we start making about, quality programs as opposed to, well, you funded me last time, why aren't you gonna think about funding me? And so, and some animosity was created as a result of that. And credibility and trust, for the trust within the community. Marcia has done a absolutely fantastic job, overcoming a lot of that, but I think there still is a little bit of history there. As far as when you're talking about results, our first indicators, they were terrible. It was still to a certain point, they still aren't great about.
It's throughput, not impact.
Right.
It was, yeah, how many times did you attend? And our criteria was, in my opinion, and everybody on board knows it, was terrible because we only required somebody to show up one time, for some of the programs. And then the results were, did you get anything out of the program?
How
Not,
much, how well,
yeah.
and is anybody proud?
And obviously popular programs, because there was the feedback that was really good. But as far as, turning the needle, moving the needle any, we don't know what, what it, I think that's probably our biggest challenge. As far as coming up with good results for some of the after-school programs. The summer programs, I'm kind of ambivalent about, and I think the summer program is something this board have a discussion about as far as prioritization, because while they are very important, when we compare it to the other priorities, like, having a child something do in the week or in the summer, as opposed to actually learning, having money to teach them to learn, as far as how to read and how to do math and some other things, where do we stand there? And I think the board struggles with that. I think we need to come up with solid, and use the criteria that we used for the results that you showed us. Okay, how does it compare to all this? Tell us how you're comparing, how we're gonna make a difference, because in a few years, it's gonna make a difference whether we go forward as far as whether we've been relevant. And I think that my years, I don't think we're necessarily growth, but I don't think we're mature either, because we're somewhere in there. We've got, our first director did a good job as far as starting, coming up with the policies and whatnot. And I think Marcia has done a tremendous job as far as getting into the community, overcoming some of the obstacles that were there for her. But overcoming that and getting the community, maybe the trust has potential. Now we've got to take that potential and job and deserves another shot at it.
This is the kind of conversation we were hoping for. And as we start looking at what and looking at.
I look at these indicators and it's nice to see them kind of again. I think these were the areas that stuck out to us from the data we had available as areas that needed improvement. We're not going to do it for everyone. And so moving the needle on a community level for these areas, I think these are still the areas. We know we had infant mortality and low birth weight. All of those things were true and are true in the community. Question becomes, are we going to move the needle community wide? It's very hard when we're only touching 400 out of the 1,200 births, right? To move it community wide. But are the programs beating that expectation? So if we know that there's low birth weight for women in this community in a category, are we moving that needle for the women who enroll in our program in that category? We're not going to move the needle community wide if we're only touching a third of the births. But we can maybe move it against that benchmark for the women who, and I think that's the kind of impact measure. I really like that relevance, impact, sustainability as a criterion for looking at whether somebody is fundable or not. I just think that we need to be mindful that organizations start around the issue of relevance and impact, and sustainability is what you work toward, right? You're not sustainable at the beginning. Nobody's sustainable at the beginning. And we've got a lot of beginning organizations for whom we are the only funder. And as I used to say, every time I applied to a grant and say to my staff, well, if I already knew how to fund this damn thing, I wouldn't be applying for a grant. And a lot of our organizations are in that boat. If they knew any other way to get the money, they wouldn't be applying to the trust. So I think we've got to figure out how to balance all of that.
I don't know necessarily agree with that last. I think that there are some organizations that us is not looking at other places.
I agree.
You know,
I agree.
we're the cash cow.
And I think we should ask as part of our RFP process is, have you explored other sources?
I'm sorry, I interrupted. I
Okay.
apologize.
Good discussion by my colleagues on the board, and I can agree with a lot of, but I think, also, I think we probably, there's a lot of talk of where the turn is and our organizations are, but we probably need to do the selfie for the trust. Because, and evaluating, the programs that we're funding and relevant and if they're sustainable, we also have to look at the trust in that, because we've got to prove that same thing. So there really is this competing thing, right? And this new vehicle we went to the public with, told them it would be certain things. So it was new and infant, it's growing. Relevant, because we do have the need, making an impact. So we've got to like balance the impact that the trust is making with the people in the community that you're funding, and then you're telling them we're not going to fund you because you're not making an impact and you're not sustainable, but we want to get renewed.
But they're not going to fund us. If we're not.
That's what exactly.
And they're very clear about that, right?
That's so
About that.
we got this circular thing here, which is first the chicken or the egg, and so I think good discussion, and I don't think we're like totally off base. I think, to start an organization from scratch to like funding in a community. I don't know of any, we could have held the money an extra year until we implemented policies and came up, but there was really, it was really this untenable balance mission or whatever. I think
We were building the plane while we
we
flew.
were building the plane while we were flying it. So our first goal probably should have been in that community capacity building, which is where we were. We were.
To be commended for being here today, because this is what this is all about. We get to have these type of conversations and really take a internal look at not just who we're funding and our providers, but also the trust. Now, I know we have a couple of people online.
Yeah, and
couple of
just as a reminder, when we're speaking, if you can kind of hear that little bit of echo, then they can hear you. Otherwise, they can't hear you. So.
Okay. Dr. Hart, you had a raised hand? Did you have a comment?
Hi, can you hear me?
And
Okay, well, Lee, thank you very much for reminding people to speak into the microphone. We have an excellent AV system, but not if you don't use it. And I think our speakers are doing a pretty good job of hanging to the mics, but the people at the board table are having no trouble hearing each other. So that's why they're not using their mics well. Anyway, could I just revert to the question that that everybody was discussing and just chime in about this coalescence between our health goals and outcomes, education, and safety. And I'm not going to address the resource centers and community capacity building right now, because that seems like that's something on the table. But I've had a concern from the beginning that we will not be able to improve the health outcomes for children, and children, of course, grow up to be adolescents and grow up to be parents. So we care a lot about all of the ages of the children until we address the safety issues in our community. And I think we've been, quite frankly, clumsy about trying to address the safety of children. And that's why Nancy has this mantra, our partners, our people who are getting our money don't really know how to do the trauma responsive things and the trauma assessment, and they don't really know necessarily how to identify traumatized children. And I get that. But in order to make them have the capacity to actually improve these community-wide numbers, we have to do something to help them. And I would suggest the thing to help them would be the meta programming. In other words, have experts in our community visit the other programs as they're ongoing. And either do the assessment of the children, identify the children who are traumatized, make advisement, train the staffs what to do when they recognize that a child's being traumatized. We're not being proactive on the safety part at all. And I think if we were, we would see our low birth weight babies go down, and hospitalization for self-inflicted injuries go down, youth who felt sad or hopeless go down. But until we address the safety issue, which gets the smallest amount of money, has the smallest number of providers, and now we're putting after school programs in there. Well, yeah, I guess so. But I think that's not what we meant when we wanted to improve safety for children in the community. It's not just after school programming or summer programming. It's what happens during those programs. So I think it's a really hard conversation for us to have, to look at what we're doing and try to fix this. And I would be sad, super sad, if we decided not to measure these things anymore. I think that would be the wrong way to go.
I think what Nancy was just pointing to is, I think when we talk about capacity, we need to also be clear. Business capacity, right? There's the organizational capacity, and then there's a competency kind of capacity. And I think a lot of the meta programs that Nancy is referring to, and Nancy, I know you'll chime in if I'm misrepresenting your point, is really about competence of these programs that we fund to identify certain conditions and intervene responsive to those conditions, as opposed to business as usual. And then we've got this other whole capacity issue, which is more the nonprofit stuff that Teresa was talking about in terms of capacity. And I think the competency piece, both relevance and impact, right? You can be most impactful if you have a certain set of competencies. And then it falls to us, if those programs, to say, if you're valuable enough in this other way, are we going to then support your growing competence in these areas that we think will make you even stronger? Is that, Nancy, does that get to some of what you're thinking?
Kind of. I don't think we want to abdicate all responsibility to the meta programmer, but the meta programming allows all children who are in our funded activity to have some measure of protection that they don't necessarily have now. And we do it two ways. One, by sending the other organization in to help or teach the staff at that organization, and even teach the children how to identify other children who are sad, feeling sad or hopeless, for example, or who are expressing behaviors that make us think they've been traumatized at home or school or church or who knows where. So I think, yeah, we shouldn't get confused about our use of the term capacity building, because indeed, we want to increase the capacity of our current programs to identify trauma in children. And I need the judge to help me on this, because this is always where the judge chimes in and says, yeah. Childhood trauma is a huge issue in this community.
Eric?
No, this is making me think that the meta programming, the focusing on the most core things that we want young children to grow into be healthy, functioning adults? And is it realistic to have all of those providers who are focused on, tennis or teamworks or whatever, to have that skill set? Or is it more, do we have a better shot at this coordinated system of tapping expertise who can come in and say, these are the important things about trauma-informed care or healthy and safe children, and we are going to beat that drum and have that common thread across your programming consistently. I don't know that there's enough money in the world to make sure everybody in every single program knows how to deliver that with fidelity. But there are people in our community who do, like, we are rich in expertise. And if there's a way to bring in that coordinated system element through those providers, rather than, and when you talk about capacity building of the providers, that's them knowing how to run their business and et cetera. But in terms of these key measurements, I think we've got a better shot at a coordinated system of backing up and thinking about what we can infuse that is common, that is key and critical to that goal area 1.
I want to add on to that, may I?
There's resources out there on how to become. a
Yeah,
trauma
I just
informed
want to add on to
organization.
what Mary and Dr. Hart are saying. I mean, the elephant in the room is that we are two worlds in this community.
Yeah.
We are the haves and we are the have-nots. And many of the haves, while they value and voted for the trust, want the trust services to help the have-nots. And we also know that 2 out of 3 African-American kids are not reading at grade level. Period, full stop. It's been going on for 2 decades. So every provider that has African-American kids in their programming can help us with this meta approach of identifying where there is trauma, and not just African-American kids, any kids, but specifically, this is what we have as a community have talked about. And I think that's really, from my perspective, everything I've been hearing my colleagues, the shift that I'd like us to see in this strategic plan. Because if we don't do that, then we're not going to move the dial. We're just not. That's why we have a trust. I mean, essentially, we have all of the resources, the best and the brightest, literally in the world in this community. My opinion, they've got to be focused right in on what this community says.
Have to carve out more money for like the meta programming from the programming themselves. And then instead of fully funding a $300,000 ask, we say, well, we fund you $150,000, but as part of that, we also will provide you these services that we want all of our programs to participate in. That way it's kind of that equalizer that's happening.
And there are really clear guidelines and resources for structure, but also to how it delivers its service. They're out there. You don't have to invent this. And I'm sure that the Child Advocacy Center folks know those resources well and can certainly do that kind of meta programming across all of our organizations. But then I agree, Cheryl, we have to build that into the contract that you will
That's our help.
to accept our help to do that, and then to become trauma informed, which makes me think that this capacity area should then maybe have two areas of focus. One is this competence area, and trauma informed certainly critical. I don't know if there may be others, maybe literacy, how to spread literacy throughout any type of programming, and then separate from that, capacity building that's on. And that will get us some goals in that area too.
Yeah, it would get us some goals in that area. And you brought up too, how you look at your funding. So don't lose that. Keep that in mind. That is going to change. Okay.
So the rubber meets the road.
Yes.
Talk about what's important.
Absolutely. Those levels may change.
Best value statement is your budget.
So you may remember we asked you a question when we talked to you about what you do well and what accomplishments you've had, what challenges, what keeps you up, what do you think about? And we took the information that we heard along with some of the things that we've read, and we started populating a SWOT analysis. So we want to take a look at this, and then we want to give you an opportunity to say, nope, yes, move that, add on, however you want to, whatever you want to do here. But because this is so light, I'm going to read these to you. We heard that your strengths.
Page 24 in the book.
Yeah, or.
Yeah. Okay. Your strengths, leadership, both on your board and your staff. We heard a lot about your staff's capability. We know that you have a very diverse board. You come from a lot of different industries and very engaged. We heard that. We felt the passion as we talked to you over Zoom. It came through loud and clear. Felt that you had a solid agency infrastructure. Our systems are pretty good. We have RBA, we have SAMUS, I always say it wrong. We have systems in place for managing our work. Said that you have a wide variety of program providers. I believe you fund over 80 programs. And you're funding programs that are allowing your youth and your families to thrive. You were proud of that. So those were your strengths. I'm going to go through them all and then we'll circle back. Your challenges were, we don't always adhere to our strategic plan. One of the reasons we wanted to remind you of
Not us.
The folding board.
You don't always align yourself to the decisions you make, don't always align to the strategic plan. That's what we heard. Heard the maturity of the core business model. We may need to look at that. We heard some things about maybe processing of invoices and what we require for reimbursement and those types of things. Maybe we could simplify that. We also heard that maybe we should look outside of our own sphere of influence too. What are other folk doing? We don't have to reinvent the wheel. What are they doing that's innovative and that is making an impact? Any business like this, there's always going to be more children than money. So limited funding to help everybody that we want to help, which is one of the other reasons we're here and focusing in. And then meaningful partnerships and collaborations. And we just had a very rich discussion on that. Opportunities. So if you have challenges, there's always going to be some opportunities. And these kind of mirror your challenges. We have a challenge defining and measuring the greatest impact, what we're doing and who we're funding. We have a challenge with really stepping up on the partnerships and collaborations. Heard a lot about their folk at DCF. We heard about the school system and the judge is UF and Santa Fe College. So there are partners out there, YMCA and United Way, there are partners out there, but are we really forming that partnership and collaborating with those folk that we need? Then we heard about vocational and educational programs, primarily for the older youth. Let's bring in some new ideas and innovation. Obtain community and stakeholder feedback, maybe in a more formalized way. We heard about the changes in administration at certain levels, especially maybe in the school system. A lot of change. I think we've heard you've had a number of CEOs in that system in a fairly short period of time. Maybe look at a way to go a level past that and really kind of take hold and keep that momentum going as the top changes. And review and update strategic objectives. And we're here today doing that. Okay? Now, we know that there's always going to be external threats, regulations. Always. So we have some local funding, but we also probably rely on some federal and state funding. Access to healthcare, changing as we speak. Then, as Ken talked about so passionately, low rates of youth literacy. So let's talk about these.
I would add to our strengths, our community expertise, and I think we have established really with the current leadership team a level of community trust. I think that market it as much, but I think we've started to market it a lot more. I've heard in the community last year more positive things about the work that the trusted fact they're trying to make or they're making than I heard in the first 4 years. So I think that is a strength, and I think we should capitalize on that.
And so your brand is a good brand.
Brand is getting, better. Gary?
It's growing.
Two things. I would probably put that wide variety of programs at 80 programs funded, where it's a strength, it's also a weakness
Okay.
or a threat. And also y'all made the mistake of interviewing me right around the time that the July 1st and the one example of things changing beyond our sphere. The decision by Florida to take fluoride out of the water happened, and I could not get out of my brain that presentation. Sorry if I said it several times.
No, that's
but the funding we did for dental health and health, and the children who never see a dentist, and so I just think that some of the things we've touched on, that breadth of 80 things, danger we all have of mile wide, inch deep, but the changing because the issues are changing and other funding is changing.
I think a threat is going to be the pressure on our provider community. Opportunities that are going to have been back at the same time that our provider community is access other funding.
Yeah, we heard that. We heard that.
Heard it already, and it's
So as a threat, federal and state funding, that's a.
Mental health, which is one of those areas. Roughly.
So
Mental health.
Yeah, so when you said limit our funding, I don't feel that way. I guess maybe I did not communicate that well.
Well, I'm saying it because we're trying to move down to that 8, that what we're bringing in as opposed to dipping in constantly to the.
What I want us to do is focus and say to our providers that are either in that terminal or in declining, we want you to succeed. Now have, I think, a level of, I won't say authority, but we are the funding source for many people. Want you to succeed, which means you must now collaborate with those that are succeeding, and that funding may go through that entity, which forces them to build their own capacity or join or find whatever one of those 4 legs is wobbly to strengthen it. That's what I mean by by focusing our fund, focusing how we fund those organizations.
How do we incorporate some flexibility? You know, yes, certain things that are beyond our control that may happen, you know,
Federal level, yeah.
federal level, you know, without jeopardizing our ability to focus.
I mean, isn't that one of our strengths or opportunities, that we are nimble, you know?
Yeah, I don't know where to put that,
So-
but that's been an issue.
Opportunity.
But it needs to be kind of on a yearly basis so we can incorporate it into the budget. You know, that our RFPs, we do our, you know, do we do a set aside or how do we, you know, press, say like suddenly we see you know, there's a sudden upward demand, you know. How do we incorporate that? Got our money tied up in RPs and all this on a yearly basis. How do we provide ourselves a little bit of massive amount, but
I think that was the source of that 5%. That's where that.
I'm thinking that kind of situation is where you do come in, at least in year one, with fund balance, right? That's why we want to have a healthy enough fund balance that if some crisis occurs, we can say, okay, this is a critical program. It's showing good impact. We need to expand it immediately because this is going on. Next year's budget, we've got to figure out how to incorporate it and focus and decide whether that happens or not. I think those kinds of emergencies are appropriate 1 year use of fund balance to.
the key is 1 year thing,
Right.
you know,
Yeah.
with no
But
expectation.
then the next year, we've got to figure out where that still falls within the remaining priorities and collaborations.
And I think it has to be communicated really well, because that's where we end up
Yeah.
with.
Absolutely.
Yes,
Once funded, forever funded.
Yeah.
right, and.
Well, and that's, yeah. That's the challenge with grant funding, yeah.
What else on?
RFP process, writing the RFP in such a way.
Get credit for that.
If they bring some of the little ones with them
Love
as
that.
a part of the process, that I don't know if that happens a lot in the nonprofit.
I had this, okay,
Marcia, we do that's available for all the starting up companies, correct?
No, not necessarily. It's for anybody who applies.
Okay, so
Any of them can join.
that is theoretically, because that teaches,
But no, but that's for, I was just gonna say, that's for early learning only.
I had this really weird thought. Throw it out there. I haven't.
oh my God, we're gonna be in your head.
Yeah, that's a really scary place, trust me. But what if we said, we want to allocate X number of funds to mentoring? Got like 50 organizations that say they do. Figure out how you want to share it.
Say to all the organizations.
As the RFP is, we're putting out X number of money on the street to those who collaborate, partner, and do a collaborative mentoring initiative. Guys, figure it out and give us a proposal for how you would, I mean, again, I haven't even vetted that in my own head. It just.
That's how we did it at the Children's Services Council. That when we were first talking about the maternal health program, we didn't know what we were looking at. We didn't know who would work in that program.
And identify a lead agency so that the money only goes to one and you guys, you know, then they may not be able to distribute that, but it begins, you know, again, like I haven't thought it through. But if we basically said, we're going to have a pot of money for this, come to us with a proposal for a collaboration.
RFP needs to go out very early.
Well, yes.
Cause it took time to put.
Yeah, and again, like I said, it's just,
And maybe stay out a little longer.
yeah,
than-
right.
than normal.
Yeah, while people fight it out.
While they find partners.
I mean, I think that's a.
How would that work, Marcia?
Mentoring
You know,
because
you
we're
know,
not holding back. like that now, saying, here's our thought. That gives them, you know,
Come back to us with ideas.
Propose, yeah.
And it may be that we do that as a way of shaping an RFP, so maybe kind of a pre-RFP. I don't, again, like I said, it was a sort of
You know, they
wild,
can-
out of the box thought.
Forced collaboration.
That I had.
Well, it also promotes buy-in by the
Right.
people that worked on the project.
And it also, if they know they don't have the organizational capacity to share money that way, may make them find a mature partner who can work with them in that way. Conchita was saying to manage the money, the business side of that.
You talked about a pre-RFP, you know, a lot of companies do a RFQ.
Right.
Christy was just saying
for
there are ways to do
qualifications.
that.
So there are ways to do that and to find out who's out there and who's capable and who's even, before you actually put out the formal RFP.
And I think we have enough contracts now that are still a year out, that it would be an interesting opportunity to do that kind of thing and have the amount of time.
Well, nobody's funded for mentoring after September,
Okay.
so.
but, okay,
And I wasn't,
Yeah.
mentoring just came to mind
Okay.
because I know that there's a
Yeah.
ton of little
What
ones.
you're saying, this is
Yeah.
a way to do this,
Yeah.
regardless of what it is.
so what's up next? We know that
RFPs that would go out next, we have after school, Alita, is she? After school, the summer
So
camp.
enrichment. after school.
Enrichment, yeah, those are the two.
Again,
So we have an opportunity.
it's just
this-
something to explore.
ideal opportunity, you know, get what our ducks in a row as far as the enrichment.
I'm gonna call for a 10-minute bio break, but before that, I did want to say, as we get into a discussion of how or what we might do differently, I'd like to better understand. And I personally would like to get rid of that phrase. I think I've said that before. But
I think we call them the innovation grant.
yeah, innovation, incubator, whatever, because that could be a whole different thing. But I'd like to understand that a little bit more, and also the sponsorships, how much that's all adding up to, and
Sponsorships are $60,000. That's the
Yeah.
cap.
okay. And then how much goes into innovator or the incubator?
Those are 15 to 20, and we've only done, what, 3 now?
See, and I think if we're gonna use that as a capacity building fund, that's just not enough.
Dr. Hart, anything before we take a break in a little bit?
Okay. Dr. Hart, did you have anything before we break? No, okay.
Are we gonna come back and still be able to add?
Yes.
Because I've got a thread I'd like to add, but bio.
Absolutely. Okay. 10 minutes, please. Thank you.
our strengths, weaknesses, opportunities, and threats. And we were discussing whether we should remove, add to each of these areas. So,
Add a threat, which is the inability to document our impact.
okay.
I would say, Maggie, from my perspective, being on the library governing board, other institutions, I think, from a evaluation of programming, this board and Bonnie and her team as good as any, especially at the age that.
I absolutely agree with that. That was not a criticism of how far we've come, but it's one of those areas again where we're growing. I'm thinking of a campaign to refund the trust and thinking that saying we did 20,000 kids or 100,000 kids isn't enough if we can't say they're reading better. So
Losing trust.
right. So I think that, yes, I think our evaluation process has become far more mature. I still think we're too focused on outputs, not actual outcomes that document impact and support relevance.
Go ahead, please. Lee, and then Dr. Hart, go ahead.
Ladies first.
Okay, Dr. Hart, go ahead.
You're on mute. Yeah.
Yeah, I was thinking during our 10-minute break there about what Maggie said about the threat. We have already listed reduction in healthcare available for children, but specifically mental health care is something that we need to consider as a special exclamation pointed threat. Because if we succeed, and Nancy gets what she wants, which is meta programming, where all of our providers are trained in how to recognize children who are traumatized, and the children participating even learn to do that. Once we recognize children who've been traumatized, then what? Oh shit. If we don't have any, you know, if we don't have any mental health care to offer, then
Well,
we've
you caught
done
the car.
nothing.
Yeah.
So we have to, I think that's a huge threat, and we need to plan ahead that may be an issue.
You know, Mary mentioned the loss of fluoridation as a threat to oral health. Well, like I said, that 80% of your funding for people who are not well-to-do and have great insurance for substance use and mental health is Medicaid driven. Medicaid.
And I added Medicaid
Yes.
funds, the law.
State and federal, so they've done away with half of the budget for the substance abuse and mental health services. Aggregating arm and drug abuse and treatment funding arm. And now Medicaid is likely to become harder to get. And Medicaid, I will tell you that at Meridian, probably 90% of the children we saw were Medicaid funded.
Jackie, did we put in weaknesses this identifying trauma?
I think for our providers, becoming trauma informed would be, I would capture that as a whole.
Put that under our weaknesses?
Opportunity.
It's an opportunity. I think it's a real opportunity. Yeah, trauma informed.
I heard her say consistently because they're getting the trauma informed
Right.
training.
Right, but there is a
But-
whole structure for
Yeah.
trauma and becoming a trauma informed organization. That is a whole process, and it's not a simple one. I have to tell you guys, it's not you take
One and done.
Yeah, you don't go to a workshop and it's. I don't know that they offer a certification. I haven't looked at it honestly since I retired 5 years ago. But yeah, there are whole systems for becoming steps you can do, training. Yeah.
I think cuts, I'm sorry.
Go ahead, Cheryl.
The cuts to education are going to end. I know my kids haven't been in school for a while, but I still get emails from the school that are already proposing affecting cuts in certain programs. FedNet coordinators, it'll be the people. Cuts to SNAP benefits. I don't know how that's gonna fall out, but I know if you've got hungry kids in school. So all of the federal funding together is trickling down to state reductions.
And then Tina?
So Marcia, our RFPs for, they say what goal they're going to, their RFP process, yes? Actually, we actually identify.
Typically identify
Okay.
the goal that the, whatever that special category is
So if
in.
they're doing that, and we have these indicators. Why don't we ask them to respond to that? How are you going to do that? Tell us whether your program, and then we can.
That could be done.
That seems like, we've been dancing around the indicators, but now, tell us how you're gonna satisfy, and some of them, they probably can't do, because it's probably.
And I don't think that all of our organizations can become fully very complicated, and it's not easy, and
It's a meta thing.
but they certainly can become, I think we can provide points for how far along that continuum they are, or how much they're able to document that they've done. And so you may be able to get like a bazillion points if you fully there, but otherwise, do you have these elements in place, and each of the elements gets you a certain credit, if you will.
And then
Maggie also makes
track your. Right.
For our.
Yeah, well, yeah, that's been you've got a soapbox and I've got one, and mine is data that demonstrates impact.
I'm right there with you with.
The better off. It's the better off. I think we're doing the how well and how much really well. It's the better off piece that we need to get more.
So I'm not sure really where this would go. I've been sitting here trying to figure out if it's a weakness, if it's a threat, if it's an opportunity, right? But in determining how well we're doing, and we're trying to build this case of, right, measuring what we do. Ken knows where I am with the literacy thing, right? But I'm gonna repeat this again. I think it is unfair to expect a voter approved referendum or independent taxing district that's max half mil to change, to shift and impact literacy such that. I think we're hanging that anchor on the wrong organization. So I think
It belongs on the school board, is what you've always said.
it belongs on the educational system is what I'm saying.
Yeah, yes.
So I think the collaboration and also the health and safety, I don't disagree with what Dr. Hart is saying. But I think we get max half meal, and we're not even assessing a half meal. And health is a big thing, and the safety is big. So maybe we can't save everybody. I don't know, maybe we gotta narrow the focus or whatever, but I just think like with the literacy, that one I think is a big one, and we do wanna improve it, but I'm just to try to make a case and to say we failed or didn't do enough, because most after schoolers, they only have the kids a couple hours every day. So I'm not sure where to put that, but I'm thinking the intersectionality of the needs in our community and how the trust fits in. We got to figure out and manage the expectations of our community and what we can do in the whole.
I hear you on that, in the core responsibility, the education system may be a more appropriate measure in literacy for trust funded things that are community. That they are aligned and, church-based, and they're not random acts of literacy, that they're like, we have expertise in the community on the best ways to support literacy. I think it's an expectation that other efforts know what helps kids really learn to read, as opposed to, we have some books, or kids get books. I think they can be supportive so that they're an echo chamber of the same focus of the school district and people aren't going about it in randomly different ways.
So I can agree with you on that in that sense, but to me, what I have heard, so we have some providers in the after-school space, for instance, that they realized that the students that they were serving had deficits, right? That wasn't their initial mission. Their initial mission was something, and I'm just gonna say ACEs in motion. Their initial mission was to provide a sports-based after-school program. But they shifted to the academic space, right? And finally got into where they're trying to hold them. But I don't think it's fair to say that we're not going to continue to fund them because we're not seeing academic improvement in our students, because they're actually trying to support, they're trying to collaborate with the school district to have them. And I think probably of all of the providers, they probably do it better because they've been around, they're mature in that area and having data sharing agreement and things of that nature with the school district. But I still think that's just that's really is not their wheelhouse education, but they have somehow tried to pivot, but they're not hiring educators. They're doing tutoring and things to a better support, and they're working with like Peak Literacy, which is another funding organization to try to help the students close that literacy gap. But I guess for me, it's a threat because I think we don't want to have a bar set too high for the community. And when we don't, if we should miss it, the folks are upset. It's an opportunity to really close the gap and where folks are operating in silos. But it could be, also like, I don't know, managing expectations of what folks expect for us in that literacy space.
All right, Lee, and then Marcia, and then and then Maggie.
Yes, Tina, the question kind of goes to you, possible, because there is a way to address, wide, but those children that are involved in trust programs, preschool, because as I said before, y'all can't be y'all get a product, and try to do as much with that product as you can. But child that is behind, it's hard to get them back up. So if we can help the children and family before they get to school, where they're ready to enter school, and then after, in the after school programs, we provide money and they're providing some assistance there. Is it possible to work with the school board, get the information, to say, we have a child, what were they last year? What were they this year? They're involved with the trust. Is there a difference? And if we can, if it's possible to get that type of information, the coordination, then, we can say, this child was funded with trust money. Here's what that child was, before it started our programs. Here's where that child is now. And look at, hopefully what a dramatic impact it's made. And, so we don't have to go system wide, but we can say the children whose the trust has been involved in their lives, we have helped them, put them on the path to success.
Marcia, Maggie, and then I see Bonnie coming to the mic, so go ahead.
Well, I might need to, I just want to make sure though that I've captured what I put under opportunities manager.
Yeah.
And I heard Lee.
How we do it?
Getting the partnership and collaboration. Off base here.
She's really talking about managing expectations.
Managing expectations, yeah.
All the way around.
Yeah, I think that's there, and I think that supporting the literacy through that, you can leave that there, but I do think the opportunity there is to really to manage expectations, especially entering into the threat area with the funding, state and federal funding. You don't have to add that, but I do think in this next where we're entering, because what's going to be most fresh in folks' mind is that the last few years leading up to the renewal. It's not gonna be the first 8 years.
It's recency.
It's gonna be recent, what's recent, where we're
Have you
headed.
done for me lately?
Yeah.
Janet Jackson.
Maybe that should be our theme song, huh?
So I see Bonnie coming up. I want to make two comments and then I'll turn it over to Bonnie to talk about the agreement that we are currently in process with the school board. I cannot say enough how important communicating and working with the district staff has been, from Jaquetta Roll and to Dr. Patton, that we have been able to communicate and work with them. And so, Bonnie, you want to talk about the agreement, the data sharing agreement that is in process?
Sure. So we do have a draft of the data sharing agreement that's just awaiting signature. That would, so we have several programs that do have a literacy component. We have our Freedom Schools, we have our Peak Literacy Program. Have our Head Start Summer Bridge that focuses on literacy growth and has programming to address that within their curriculum. In those programs, they do have tools and measures that measure at pre and post to see the progress of the students, and they do demonstrate that there is growth occurring. Even with several of our after schools, not all of our after schools, they do have literacy curriculums, Youth Fly coming into two of them now. So there are, and they do measure pre-post through assessment. That next level is seeing how that translates into, certainly with Head Start Summer Bridge and our early learning programs, to how those supports then help them transition to be strong kindergartners. So that is sort of, as we move from growth to maturity, getting those secondary data sources, that long-term sustained impact of our programs. And also another quick note while I'm up here, we do have in our current fiscal year with our 83 programs around 242 better off measures. So they range from confidence to skills building to career readiness to mental health symptoms. So we do have a variety of outcomes that we do measure. I think, getting it out there in the community more is something that I'd like to see more of.
Can I ask Bonnie a question before she leaves?
Go ahead, Lee. Lee, and then
Bonnie, it doesn't have to be just literacy programs, like all the pre-K programs that's important too, because that's where they start their foundation. So, measure, other than were they ready when they start. I think that's pretty important. I mean, if we consider our program successful, they're gonna be ready when they start school. How are we addressing now? Literacy, where it's direct, having a child ready for school, literacy, that is a very strong component. And if they're in our programs that we're paying for or helping, assisting, that ought to be a major thing. Measure, how are we going to measure that?
certified.
So
I guess the best way would be when they entered school, were they ready?
yeah, that is one of our key indicators, is the kindergarten readiness. It's how is our programs each have indicators that are performance measure indicators that are leading them into pathway to getting our big outcome, which is the kindergarten readiness, and that children.
So we'll consider that part of the statistics that we.
Yeah, literacy is a component of the kindergarten readiness. It's literacy and basic literacy.
And then Maggie?
No, longitudinally, is there a way of tracking students from before they enter K-5, the pre-K and the Head Start, since Head Start is not at the district level anymore? But we are funding that summer bridge. Do we have a way of identifying students to, the student progression, to be able to see
have for our Head Start summer bridge programs and our tuition assistance have with the ELC. So those children, or we would hopefully be able to see our agreement where they fall when they get into kindergarten
And beyond, yeah, yeah.
and beyond, yes.
I know I'm repeating myself from prior meetings, but I think that there's literacy and then there are things that promote literacy without being books or reading focused, right? And I think that part of what we've got is after-school programs all lumped into this education goal. And really, they're not all about education, and I think we need to put them in the right bin. Some of them are just really around safety, having something to do that's positive and promotes self-esteem or other things, not necessarily literacy. So I think we need to put things in the right goal area to address some of that issue. The other, I think, is, again, we know what supports and promotes literacy. We know that, for example, kids that have the ability to go to enrichment camps in the summer have a lesser slide over the summer in literacy and other skill sets than kids that don't, right? So again, are we looking at programs when we look at summer school is one of the criteria, not necessarily teaching reading or skills, but the things that we know happen for children who don't have a summer slide. And therefore we can say it promotes literacy, it promotes math skills without necessarily teaching that. And I think if we put things in the right bins, I think that will help. And then my last is, ACES in Motion managed to get a data sharing agreement. You're going to have one. If that data sharing agreement can cover all of our programs, terrific. Okay. Because if not, I was going to say, can't we help the other providers to do what ACES did and get data sharing agreements for their specific kids? But if we can do it globally for the trust, and we can say, okay, these programs had these outcomes, and we can tie the child, the program, and the outcomes, terrific.
And does that allow us to redefine all?
Right.
We talk about all children,
Right.
but if we can say impacted by the trust.
Right. Trust funded, yeah.
That's a
Yeah.
good point.
Yes, you're not, that's,
Please
yeah.
don't.
That's
Yeah.
all in the vision statement.
I think that's across the board, right? I think
That's what I'm saying.
That's the managed
that's the
expectation.
managed expectation. Absolutely.
Yeah, and so Tina's reminded me of really the statute. The county commission put this form of government on the ballot, which, the two things that I'm reminded of is, one, the trust will not supplant funding. So there's already funding for certain things, and this community is saying, want additional funding. And then the governance structure was also selected, which had school board member, superintendent, Department of Children and Family, chief judge, and a county commissioner, and then 5 governor appointees that the community priorities are around. And so when we talk about managing expectations, I think we constantly need to be finding the community. Trust doesn't replace funding. It adds to
I
funding.
think that's a really important point.
It adds to literacy, it adds to safety, it adds to health outcomes. It's additive, not like Tina said, responsible for. So we've kind of swatted the SWAT to death, Jackie.
No, I love this and there's
Lee and then
Coming out.
Marcia, and then we'll try to.
I'll be brief. I just want to keep in mind, the funding that we are giving for literacy, the tentative kind of plan that's coming together. Certainly, it's all fluid, so it may change. Is really going to be how we bring all of those community partners together and utilize very specific literacy tools. And so I think you all have to think about, will we as a trust hold our partner providers responsible for utilizing those tools? So that could mean, although you aren't, I'll use, as Tina said, ACEs and Motion, for example, while their focus might be, sports related, would we require them though to utilize whatever this tool is could be you fly. I'm making something up. I don't know what it's gonna be. But that is something you all will need to think about, because we would want to put that in our contracts. We would want to hold all of our 80+ providers. You know, if you are doing something with children and there are children there who can't read, then you are going to allow, whether it's peak literacy or UFly or whatever that tool is, to come into your program and work with that child.
And measuring it forces accountability.
Yeah, so I just wanted to say that.
So our mission statement is what it is, and it's just allow all youth and their families to thrive. Okay, that's our mission statement. And however, we tend to focus not necessarily on all, but more of a concentrated demographic. And as a result of that, what we need to do is we allow that opportunity to happen. However, here's when the trust is involved, here have been the results. Our messages, we allow anybody, if you want to utilize our resources, but here's the outcome. When the trust is involved, here's what happened. Right. And I think that takes care of the whole issue.
And I think we, nod from.
The statute requires all.
Yeah.
Yeah.
Yeah, I think getting rid of the word all would be quite helpful.
All right, anything else before we move on?
Oh, you ask anything else?
He wants to stay on this.
Lied to our.
We got like an 8-course meal, 5 different desserts. And then when it comes back and says, anything else?
Okay, so now you have had a lot of background information and you've talked about, I mean, we've done a lot. I mean, you have had some great discussion. Changed the mission. So thinking about all of that, all of the background information that we've talked about today, SWOT analysis, those things that you added, I'm going to move into, in a few minutes, some prioritization. But before we do that, we're going to do a visioning section with Regine. Almost got ahead of her.
Imagining exercise in 3 years.
You haven't done one in 3 years, you said?
No, I'm just reading the agenda. Imagining exercise in 3 years.
I really do want you to put your pens down. Just relax in your seat. Because we had a lot of great discussion. And I've taken a lot of notes because it's great discussion, but you can't boil the ocean. You got 3 years to plan for it. And it's got to be a good 3 years. So I want you to relax and really work with me to get to that 3 years. I'm going to do a little breathing. Indulge me with closing your eyes as you breathe in and breathe out, and just sort of follow my voice and begin to envision what it is I'm asking. And Dr. Hart, we'd like you to join us through this. So I'd like you to take a deep breath in through your mouth, fill up your lungs, and push it out through your mouth slowly, slowly, slowly. Now with the second breath, in through your nose, fill up your lungs to capacity, hold it, and slowly push it out through your mouth. Another breath in through your nose. Again, fill your lungs. Those they're going to burst, and push it out through your mouth very slowly. One more deep cleansing breath in through your nose. Don't fall asleep. And push it out through your mouth. And now see us in 2028. We are about to look for funding. We're coming to this meeting to begin to plan on how we will look. You are approaching the building. What do you see? Who do you see? Who greets you at the door? How do you take your seats? What does it smell like? What time of year are we in? What do you see around you? Are the staff the same? What are we discussing as we're finding our seats and looking through our books, looking at our future and all that we've accomplished? You're looking to the right, to the left. Who do you see? What are you hearing? What are people chatting about? What are you envisioning? Who are our partners that are sitting in the room or have joined us online? They are looking at your future with you. Of all the things you've done in this past 3 years, how have we affected health? How have we touched education? What are those percentages looking like? Who's reading? How have we addressed this issue of safety? What are those impacts that we are so proud of 3 years from now? Who have we partnered with? Who should we have partnered with? Have we looked at those collaborators? Have they joined us at this meeting because they too are invested? Have we made a dent with children with trauma? Are the kids ready for kindergarten? Have we worked with legal and the law with crime prevention and guns and violence with children? Are we subsidizing and supporting education, or are we being separate entities providing education? Are we supporting the healthcare system? Are we supporting the law, legal system, safety? Now, when we're looking at our 3-year successes, and I can see some successes, bring us back, what have we done in 2 years? What got us to that 3-year? What have we done in the last 12 months that got us to the 2 years? And what will we do in the next 6 months to get us through that 3 years? Those things that you're going to discuss are what's going to get us to that 3-year meeting where we see what you have envisioned. Now, if you would take a deep breath again, in through your nose, get out through your mouth. Take one more breath in through your nose, push it out through your mouth, and go ahead and open your eyes. And we're going to capture some of those visions you've had. What did you say? 3 years from now, are we talking the same talk?
Longitudinal data on firm.
Have the data.
Data sharing agreement with the school district. Longitudinal data about children who have been impacted by trust support in one or more programs over time.
I saw a neighborhood that had hope,
One neighborhood.
that didn't have hope before.
One neighbor with hood with hope.
Kids in the streets,
Kids in the streets, free.
helping each other.
Nice, nice vision.
I thought people online, if not in the room, adding to our knowledge, and we're also learning about the road we'd already traveled, like other communities.
Yeah, nice. Nice vision, learning from us.
Other funders.
Wanting to be a part of it.
I want to be part of that. Yes, nice vision. 3 years. And big. What we do. Anyone else?
Only, I know you saw something.
See children going to entering their first.
Excited to go to school. Yes,
Old now,
ready to learn.
2-year-old now, that's 5.
Yes, a 2-year-old that's now 5. So we saw that 2-year-old and excited to learn. Love it.
I saw a network of partners that were working collaboratively, and I don't have, you have, and you will bring it.
A network of partners. So really doing that cohesion, and we're all supporting that 2-year-old, 3 years old. That's nice. Nice.
There's that saw us as their equal.
Oh, equal partners. Didn't come up with that one. That's good night.
Okay, what do you think?
Honestly, I was trying to envision, what that first batch of young people.
Wow. That's a beautiful one. They might be sitting in some of these seats.
That's true. We have some that have been in teamwork, so I can see they're gonna do
Absolutely.
some good things.
Absolutely.
So really I was really
Wonderful thing.
envisioning what the first group of young people for the
We're
12.
doing.
Having met the 2 interns that are here. Absolutely.
Okay.
That literally was what I was
Absolutely.
thinking about.
Couldn't get your mind to leave that vision.
Thinking about
Christy,
that
you had
one.
anything?
I envisioned
Dr. Hart?
I couldn't hear Christy at all. Does she have a microphone?
Oh.
Want me to repeat it?
Yeah.
I envisioned children who are currently in school now, who we are supporting with the confidence to continue on and navigate school, because we've implemented programs to support their growth.
Okay, are you ready for my envisioning?
Yes.
I actually took a little nap because the hypnosis was, and meditative state was very effective. But if the future is fantastic, we're going to have all of the parents participating in the nurse home visiting program, because the doulas are going to bring their clients to the table. We have made a couple of huge strides with our doula approving hospital and ways to identify families who should be visited by the nurse home visitors. And I'm hoping, I'm envisioning that's going to actually work.
Becky, can I ask Benita, Mia, and Bonnie to share?
You join us? Did you join us? Well, please share.
The microphone for.
I was envisioning us having, a system in place. I was thinking more programmatically that our RFPs, like that we're on a cycle. Because sometimes now I feel like kind of just drop them, which is a spiral effect, and we don't get to um, just having in place a systematic way of us doing our RFPs so that we can then put them out in a way that our providers can respond in a timely manner. And then that gives us time to respond. So I was thinking more programmatically, which I think that's what I'm supposed to do. So it's not that, it's not that I don't see the long, but just, us just coming up with something that it doesn't feel like we're so sporadic in the funding opportunities that we put out.
Oiled machine. Yeah.
Mine, Demetrica, bless your heart. I know you know me, Ken.
That's part of my issue, but.
Mine was more of a bigger picture of just imagining the partners all coming to the table, not just in the sense of funders, but city, county, us, the school board, and having that shared partnership and responsibility for this is our community, our children are growing up here, making this a better place. Like it's gonna take the whole village, not just this one organization.
So we asked this question during the listening project, and we asked parents and youth, is this a great place to raise a child? Is this a great place for you to grow up in as a child? So I would want to see people, this is a great place to raise children. This Alachua County provides the resources and infrastructure where children are thriving. So that would be what I would want to see.
Awesome. Got a hand up. Got one hand up.
Our newest trust member.
Yes. So I've only been with the trust about 3 weeks, but yes, thank you. So this past weekend I was at the ELC Ready to Learn rally, and I had one parent come up to me. I had a lot of parents come up to me, but one came up and said, "Oh, we know the trust. We love the trust. My kid did Kids Count this summer," and she's like, "You don't have to tell me, we love the trust." And then I had another parent come up, and I went to hand the program guide, and they said, and I said, there are after schools, there's enrichment opportunities. And she said, "My son is nonverbal, he has autism, none of that is for me." And so I was able to connect her with resources. I'm also a special needs mom, and so I think my vision is more of the first, where people say, "Oh, I know the trust. Thank you. There for me."
That's interesting how the providers are the trust.
Max is behind Emily staff as well.
Okay.
Hole in the corner.
Max.
Sure. Okay, there we go. I think I thought about a variety of things, but I kind of bring it back to, my role and kind of sphere of influence here, and envisioned very similar to Belita, of kind of just how we're preparing our providers and presenting opportunities to providers, and then in turn kind of working within our system to create, those aid and to innovate the most effective way to support providers, and maybe a more, a sophisticated way that we've come up with to utilize some of what we heard today about the life cycle and what supports are needed by, our startups versus our more mature organizations. And so really just envisioning a management system to the flow of funding and implementation. Works really well for all.
Got finance department in the corner, and we've got Katura, then we'll call it.
Having built a strong infrastructure internally with our providers to assist moms and dads and grandparents to help their kids, whatever it looks like.
Back to you.
Come on, you're here.
Just that quick.
Oh, some two in the corner. Okay.
I used to be a provider. Thanks. I used to be a provider and I had an awesome contract manager from Children's Trust. And I remember sitting down with her one day and I said, you know what the Children's Trust needs to do? Which would be great if by 3 years, a parent could just go straight to the Children's Trust site and apply for service. Right into SAMUS, put in all the information, and it might be easier, for her to, or him, to upload report cards, help us get scores. I know we'll have the data sharing in place, but in 3 years, I think when I was looking, I saw it being easier as a provider to get our families in the system so that we could just focus on programming, like giving them some really good programming and not necessarily, putting the attendance into SAMUS. A very specific vision that I had.
I could see where that would go too. I just might.
Anyone else that hasn't had a chance to share? Magic happens.
Hello, I'm Stacy Williams. I'm over the HIPPY program, the Home Instruction for Parents of Preschool Youngsters, and we work directly with the families to get their preschool children ready for success in school. And my vision is what I tell my staff is to ensure that our families are building a literacy environment in their home. We not only help with that, we help with mental health, with referrals for different programs. And I envision that our parents under that 200% poverty level, we don't understand their struggle. They struggle. And I envision for them to be an advocate for their children. We work with the parents to get them when they start kindergarten, that they're already building these foundations at home and them starting school and really being part of their education all the way through. So my mind was racing because it's a lot to think about, but for our little ones to start school and be ready because their parents got them ready.
Yeah, one more in the back, and then we'll call it.
Hello, Soria Lindberg. I'm just a person that wants to help people. So I come to listen to what you guys do and what to learn from that. So just to piggyback off what two other people said is, as someone who would love to help a newer nonprofit that's coming up, where do you go to learn what other nonprofits do? If we have the most nonprofits per capita, is there a forum, a seminar, a website, so we can learn and just from other members of our community? So just
Center for Nonprofit Excellence.
Thanks, sorry.
All right. Thank you. That was great. Some great ideas and many that that can definitely have an impact on within a 3-year period. All right, so we're going to move on. Yep, prioritization. So I said before, you've heard a lot. We've given you the background information. We've dissected your mission, vision, your guiding principles. We've looked at your strengths, your weaknesses, and opportunities and threats. So now we're going to talk about today. And we are going to look at prioritizing, starting with your focus areas of focus under each of your goals. Now, I have to say here that we are assuming, and we heard that you were
good with your goals, 1, 2, 3 overall goals. Now, we've had some earlier discussion. Maybe not. Maybe not, okay? Okay, all right,
And interrupt,
sure.
there was discussion in our last board meeting about our priorities, our
Okay.
goals, or.
Okay.
And maybe they need to be reconfigured some.
Okay, all right, do you want to, we can pivot. Want to step back and let's talk about those, the 3 goals,
I had
maybe 4?
I had some thoughts about that actually, as listening to everything and listening to our discussion, particularly Tina got this started for me around with managing anxiety. And I'm thinking, we don't provide these services directly, right? So we're not going to ensure that all children are healthy and that. I'm thinking what we need to do is we support programs that promote the health and well-being of children. We support programs that offer opportunities that allow children to learn what they need to be successful. We support programs that create environments and support safety, right? And that 4th nebulous area, I would like to propose a goal is to support the success of our provider community. And in there, I would include our funding of CNE, for example, and meta programs, so that they have their own worth. And instead of this whole mini grant, innovation grant, what I would suggest we consider is that within each of those focus areas, we have programming for mature organizations that are ready to really leverage their work, but also funding that's dedicated to startup and growth organizations that might need extra support to do what they do well, but are beginning to be able to show us impact. So that instead of just having this thing over here where we'll give you $20,000 to do a little innovative thing for a year, which isn't really enough time to do anything if you're a true startup organization, that within each of the 3 goal areas that are provider oriented, that we set aside some money, some portion of that for those capacity limited organizations, so that we are
All of them startup or growth organizations.
yeah, so they're startup and growth, so that we are clearly saying we're going to fund innovation in each of these areas via startups, knowing the kind of support they might need, which might include their membership in CNE and some other things. And yet
for all of our providers' membership in CNE. Yes.
So
This upcoming fiscal year, we've already
So-
budgeted that.
So, but other things, they may need QuickBooks, they may need, but I'm thinking that if we are going to be more mature and get out of this growth stage, we need to recognize who we're funding and for what, and that we can't do it all. We're here to support programming. We're not here to make all these kids healthy. So that's my proposal for revisiting how we present our goal areas.
Actual goal. We're gonna now have a 4th goal.
Right, that is to support the success of our provider community. Within that is our funding for the Center for Nonprofit Excellence, for any provider training and the meta programs that support the ability of our programs to do the work they do more effectively. That's my thought.
So Maggie, Christy, oh.
Go ahead.
Maggie, Christy was showing me in the proposed budget, we had set aside funding for the QuickBooks, all that stuff. So CNE is getting $200,000.
And that's fine. I'm just trying to, I'm really more conceptually.
I got you.
Yeah, talking about, let's set that up as a separate goal area where we want to commit to supporting the provider community so that their quality remains high.
And you're saying rather than those set aside grants being set aside, that they're within those categories and
Because the 3 goal areas would have.
yeah, I am an incubator startup in this area.
People that need some capacity building before they're ready to.
Because they're not ready for the deeper.
Exactly.
Just fit the guiding principle number 8 of rewarding efficiencies of the ones who are ready.
Right.
While providing a place for the next providers to develop.
And do it consciously within each of the goal areas so that it's more deliberate, intentional.
short-term funding for those.
It could be short term or, I mean, yeah, I think that we would have to have expectations that they get out of startup and,
Right,
you
move
know,
to a
and move
next
to a
level.
more mature, yeah.
Okay, I want to make sure I capture it correctly. So is this a fourth goal or is this something that will go under each? Okay. And the program and funding for mature programs separated from startup and growth funding for programming, nonprofit excellence and meta program are the focus areas.
No, the CNE, the Center for Nonprofit Excellence and Training would be under that fourth goal.
Okay,
But within each of the other goals, set aside funding.
this would be
programs
all,
that allows-
in all three.
Yes.
Okay. Got
So
it.
Maggie, right now, they have listed what you just said as community capacity.
Right.
So as health, education, safety.
Yeah.
You're saying it's community.
Yes, to our provider community. So the people that we are contracting with, we want to support them
70 plus.
through CNE,
Mhm.
through any training, through meta services that they can avail themselves of to enhance. what
All of
we
those
do.
providers are also under one of these other.
Right, right,
Yeah.
right. And all that we would be putting in that fourth goal are the things that we offer to them to make them better.
So it is capacity building.
It is capacity building. And it's right, it's supporting the success and capacity building of our providers. Rather, and then not having, because this mini grant thing is just to me too, just nebulous and we know that we know that part of the challenge we're facing is that within each of the other three goal areas, we have startup and growth organizations. Most of them they're not ready for prime time for very complex. And we need to just recognize where they are and help make sure that the way we fund them recognizes where we are and what we require in their contracts recognizes where they are.
Key, right?
Right.
What we require across the board.
And some are just, and you're always gonna have delinquents if they're not, if they're in startup. They can't do it.
Are there any other updates to the four goals?
I think that what we've been able to do is similar to what you're saying, really think about the implementation science. So we know that there are going to be organizations that need that additional support, that need that additional capacity. I think we have implemented it a few different ways through the Center for Nonprofit Excellence, covering the cost of their membership, covering the cost of having an accountant go and sit with them to support the invoices to, try to make them more accurate than what we have been getting. And with the Innovation for Impact grants, those are not necessarily an additional step for that provider who we have funded to try to get that support. We build those into budgets. We can make that a part of the RFP. If you, what I wrote down earlier when Teresa was presenting is, we need to start categorizing our organizations based on that. Startup, mature, growth, we can start doing that. We can define it. They will have to select it. And then from there, when we start working on budgets, we know that you said you were startup. We build in what those needs are within their budget. We know that a program will not put funding under the type of personnel that we know they're going to need. But if we
Yeah, they don't know. You don't know what you don't know, right?
I'm not sure of that. I'm not sure that that's always the case. There are some that if you don't know, you don't know. But if we are identifying and providing training in the beginning, saying that you will need to receive these dollars, this $150,000, and you currently have 15,000. We're going to require it of your budget. And so I don't disagree with what you're saying. I think what you're saying is all here, and we just may need to move it around a little, do a different dance, because I do think we're all on the same page.
I just think we need to be conscious and explicit. That's where we are. And I think there may be some organizations that come to us with an idea, and I would be willing, rather than giving them, just send them over to CNE and say, is this idea one that's worth incorporating? I can't tell you, my first question when somebody says, I want to start a nonprofit, and it's like, whoa. Oh, you sure you do? No, you don't. Let's see if you really have an idea that's viable. Let's see if there really is a need for that. Let's see if anybody else is already doing that you can work with rather than against. So I think that there's ways that we can do, because we don't want to discourage innovation and new ideas, but we need to be very clear that that's not somebody who's ready for any kind of programmatic funding. They may be just ready to figure out whether they should be or shouldn't be.
Dollars towards capacity building.
Right.
There's money there.
Right. I just want to see it. And, you know, I want to know which of our providers in each of these areas or which of our contracts fall under that startup. Because again, my expectations are very different. And I agree, Christy, I think some of them want to stay there forever and don't want to do it. So I'm not saying that they can stay there forever. I think we do need to expect that they begin to work toward moving forward as an organization. To Ken's point, at some point, you either work with somebody else or you prove to us that you're.
So is it a goal or is it a strategy to help us be successful with the other goals? I think is what Ms. Jackie is trying to get us to define. Is this?
I think it's a separate goal. I think we should, I think having as a community of providers that increases their skill level is strategic.
So how do we incorporate?
Right.
You have.
Right.
Incorporate the meta into this.
Well, we're providing separate training for that, right? If we want trauma informed.
Startups and.
Well, we're already they all have to come in and they all go through at least one training now. So then we would have to incorporate it. What I heard somebody say was, you know, doing it consistently, or maybe it was Nan. So it could be quarterly that we have some kind of training. I heard someone mention training the kids, right? Because that to us was the next level of that anyway, was doing something. So
because those meta programs apply to all three goal areas, right? You
That's
want
fair.
all of those people need to be trauma informed and understand how to recognize. It's just a really good place to say, we're going to set aside X amount of money to ensure that those meta programs are available across the board to any provider in any goal area, rather than trying to pin it necessarily.
What we're, oh, I'm sorry, am I?
Go ahead, Chrissy.
We were able to, this fiscal year, create a series through Connie, who presented here to the board. And so there's a trauma series. And I think what has worked really well is she now has an excellent relationship with many of our organizations across our goals. And so as we can begin to talk to her about what Dr. Hart mentioned today, having her create a team, potentially go into different providers and potentially assess, and I keep saying potentially because we have to work on, when you assess for needs, there needs to be a referral and some services for that. And where do they go? And how do we build that person's capacity? And so I think we've been successful in implementing that trauma series. She now has those relationships. It's probably the one training that's attended by the most folks. We have to almost usher them out because they really enjoy it. And so I appreciate that feedback from Dr. Hart, because I think we've started the work on there and we just take it to the next level.
Maggie, that took care of those, but that one actually wasn't one of the ones, because Ken, where there's such a skew. Goal number 2, where we're way over, you know, whether some of the other.
I think we still need to do that. I think we still need to put people in the right bucket. I don't think all of our providers are in the right bucket.
That's what I was focusing on, that, you know, do we want to do that now?
Oh, okay, yeah, no,
But that's prioritization. Yeah, we hadn't gotten it yet. We were.
Well, it's the buckets. It's like not every after school is an education, should be an education, or not every summer camp ought to be. Some of them ought to be in the other two, because it makes the area top heavy.
We are up to prioritization now, discussion of priority objectives.
We are.
Now that I've
sort of one question, because you mentioned, you know, we don't have indicators under this area 4, and it confuses me to have resource centers there, because we're not. I think we're talking about 2 different things.
I don't think the resource centers are not.
Just changed it.
Yeah, we changed. It's not the centers. It's not the resource centers.
So now that goal is going to be support the success of our provider community.
And so we need to develop some
indicators, and when we get to the indicators, we'll talk more about what they should
But
be.
I don't know where we put the resource centers, because they really work in all three areas.
All of it.
Yeah.
That's.
And that's, I think, why we ended up sort of thinking of them as a separate thing, but they do touch all the goals, and it doesn't mean that their funding can't be split between the three.
Right.
Right.
Okay. I'm sorry.
Everything.
Are we ready for priority? Okay, so under each of your goal areas, 1, 2, 3, now we have a fourth one, but I think we have talked about some of the focus areas under that fourth one, yes.
I can see if
Lunch is
lunch
here.
is here, so might we take a break, let everybody get their plates, and then we come back and we hit prioritization?
Okay.
Rather than starting and then having to stop.
Sounds good.
Working lunch, get
Yes,
your
working
food,
lunch.
get your food and,
Yeah.
all right.
I don't need to do good like that.
moving while we eat. How about that?
Thank you, Mr. Chair. I wanted to give you some time, especially since it was a real lunch. What happened to sandwiches, right?
Have to keep us awake.
We like to keep people happy.
Exactly. Okay, so we were talking about updating the goal areas. We came up with the fourth goal and some of the focus areas under that goal. We'll talk about the indicators for that goal a little later. Are there any other changes to 1, 2, or 3? To pillar 1, pillar 2, or pillar 3? Now let me just say, we're not talking about the focus areas yet, just the goal itself, because we're going to look at the focus areas following that. The goal that reads,
The overall goal.
the overall goal.
Are healthy and have nurturing caregivers and relationships.
Correct.
That's where I was suggesting moving the whole program back from those, that we're not in that all, or we're not doing it,
So what we're talking about is under health, your goals reads, children and youth are healthy and have nurturing caregivers and relationships. Go back So that wording, education, all children and youth can learn what they need to be successful. That wording. And under safety, all children and youth live in a safe community. Now we're going to talk about the focus areas under those in a few minutes, but just focusing on the actual goal right now. Any changes to 1, 2, or 3?
So the big word is, do we want to add support to all three of these goals? Instead of,
yeah, for the programs that.
Go back to slide 7.
or we could just say support children and youth
Whatever.
living in a safe community.
Katura, can you go back to, I believe it's slide, it's when it says goal areas of focus? Right there. Thank you.
Don't you think the program part is kind of implied?
I do. Yeah.
Oh, that's great.
One more.
No, that's it. That's not the actual goal.
Yeah, it's got the goals. Those are the indicators, but yeah. Okay.
We want to add support to each of those three.
Okay, so where do you want to add support? Children and youth are healthy and have nurturing caregivers and relationships. Where
Trust supports.
trust supports children and youth being healthy. Okay.
Taking it, but we're not doing.
Y'all can wordsmith it, but the trust is supporting.
So the goal number 1 under health, the trust supports children and youth being healthy and having nurturing caregivers and relationships. I'm not talking about marriage or anything.
But we should be thinking about it.
You should be thinking about it, how you measure that. So
You got the parameters, right? Right.
Underneath the core indicator.
They're saying,
yeah,
support, then how do we measure?
Yeah.
support? And whatever you do is gonna be good.
Trust supports programs that you just put programs in there because we're not in there.
The point is the word supports, then the measure needs to be around support, not the out,
Act-
not.
out.
You can't do outcomes if you do support.
Right.
Right.
The outcome, right.
And you're saying by those being your goals, that you really don't care about the outcomes, you're just saying, I'm giving money to people. As long as I do that, I'm good.
Okay.
You could say improve.
Bonnie?
Oh.
So maybe
Um,
improve the health.
What's up there underneath the goal are population level key indicators that we have. What's underneath that are our performance measures. So those are program level accountability. So the idea behind the results-based accountability is the program level accountability will feed the population level accountability, which will inspire us to achieve the goal.
Here's a wording issue. If you say support, then your only measure is how much money you're pouring into those areas as opposed to.
I mean, maybe this idea about support is more of a messaging thing as opposed.
I think you're right. I think you're right. Yeah, then as long as we take the word all out,
Of the other,
yeah.
the other
of the
two.
Okay,
Children and youth can learn what they need to be.
I like
we'll
that.
take all out of the next two. Okay,
Like-
all right. Okay. So we're leaving number 1 as is, correct?
Yep.
All right. Good. So we've captured that. Now, under each one of those, and if you would go to slide that has the focus areas, Couture.
I think it's slide 12.
Slide 12, I believe. Yes.
Good to know when we get off track, Robinson stands up, stands in the middle of the room and puts us right back where we need to be.
Actually, Couture, the slide at the top has today. That's it. There's the one. Okay. So now each of your focus areas have, each of your goals have focus areas on them. You have in front of you 14 red dots. You can use those dots any way you want. What we're going to do is we are going to start establishing some priorities. Now, these focus areas are currently your priorities. This is what you said you were going to focus on as it relates to those goals, each of those goals. Here on the side tells you which goal. So these are your current focus areas. Tell us which ones you want to keep by using your dots. So if you feel very strongly about a certain focus area, you can put all your dots on it if you want. You can use
Dots are different colors.
No, you're going to use the red for this. Okay?
Put away the green.
Put away
Pick up the green, only the red.
Okay? So you can use your dots any way you want to. If you think that the focus area should be under a different goal, I want you to bring your pen with you and put the number of the goal that you feel like that should move to. Okay?
Okay, the challenge with that for me is the challenge for that is that I think some after school programs are right where they are,
Okay.
but some are not.
Okay.
So that was this whole business of we need to make sure that we've got all the things in the right bins.
So why don't we do this? Let's do this and then let's come back
And
if
talk
we wanna
about
go
moving.
the programs themselves, which are in the back of.
Or we could just give, I mean, I think what we need to give you guys is direction.
There you go.
If they do this, you put them there, and if they do that, you put them.
Perfect.
Okay. All right. That sounds good. All right. So take a moment and look at them. Then I need you to get out of your seats. Oh.
Don't put out.
Some of them do more education support, and others are really more
Recreational.
safe, recreational, a safe activity, and not geared toward.
Different.
Well, but I think I think it might help rebalance our funding, which is now over in one area and under in others.
Yes.
With that.
Yeah, we'll deal with that separate.
So
No dots there.
No dots.
Last three, we don't.
Yeah, the
Let
number
me
four
put,
is we don't want
can I
to.
borrow somebody's? I'll just put a
Okay.
big. Right?
How's that going? So
Okay,
Marcia,
write that down. Huh? Sir?
community safety convener participant, can you?
well, I look at that one kind of like what we're doing with the gun violence initiative. We're participants on their alliance calls. We wound up giving them money. But we were a part of that. We've been a part of the when the city brought together the group for the summit.
That's a capacity.
Yeah, we were a part of that as well and provided funding.
They're building in two different.
Yes, that's the
Correct.
way you have it.
Correct.
Now, under your goals, yes. And there's another one that you have in two different places, out of school time activities in
Okay, there you go.
several places,
Oh,
yes.
Jackie,
Yes.
Do you want staff to participate or only the board before I pop up? Let me sit down.
That's a question you all have to answer.
You want everybody?
everybody, yeah.
Okay.
Okay.
Put the red stickers on the screen.
No, on the paper, please.
Where's one?
We would love to, I think we're gonna get video of you in second.
No, we have them.
I think we should.
The
Do
classroom.
you think I would have been an issue?
I like that.
We will.
That's what I.
That's very good to watch 7-year-old, 8-year-old leave.
Okay.
Waiting this thing.
This is
Yellow ones.
Nancy wanna tell us where to put the red dots?
Oh, that's a good idea.
Since you don't know where it's at.
To get input from the lady.
Nancy.
her.
12 o'clock meeting?
I do not.
Oh, she dropped off.
Well, we have two different, we have new goals. So
Got 3 dots there, so.
The family resource centers aren't, they're just funded, right?
What do you mean?
We had them before on 4.
Yeah, but it wasn't supposed to be.
That's
It
under
wasn't.
health.
It was always under health. It wasn't supposed to be under capacity building. That was like a typo. It was always under goal 1.
But it's comprehensive,
Right.
so. It's
I lost.
So we're putting up what we think is important and then we'll figure out where they're going afterwards. How to separate them.
How to separate them.
Which is the advisory board? What are we giving them?
It could be that we create one.
I lost one of my.
Oh, here you go. I'm not gonna. So those are the details we didn't get to the last time.
That is true.
Especially looking at the additional.
Like you have the hot.
I mean, you're trying to save it now.
Hey.
No,
my desk.
she got one of my scripts. I must have.
Making some progress here.
Oh,
She picked it up.
Wait a minute, okay. So how many strips are there?
How many?
We're supposed to have 2.
Should have 2. Vote, vote, vote.
Somebody has.
Tina's accusing Maggie.
Well, I only have,
I don't know.
she had 3 and I only have 1. That's why.
Oh, now you got 3.
Only use 2. 14, 2 goals, everyone.
Yellow now.
Of all of my legitimate dots.
You didn't use your cheater dots too?
I was wondering what was taking us so long to get done, like.
She just got dots, she's picking up dots from everywhere.
My dot collection.
They count.
Because I had done,
I had done a Spanish teaching thing. And so I had bought all of these stickers for Spanish for the kids. And I mean, they come like 1,000 in a roll. So now whenever I do dots, I just cut them in 4. So you get a fourth of a excelente or muy bueno sticker.
That's great.
Because I'm trying to figure, okay, I might as well use the suckers.
I say, don't want to waste a.
Yesterday, I didn't think. Strategic plan. So the night before so Tuesday afternoon, I get from Xavier, oh no, wait, I have it. It's finished. Here it is. I'm like, oh, so there
I
went the.
put that they didn't.
Yeah, so here's
because
the tail end of my presentation that just now needs to
it
get
worked
rewritten.
out well.
So I
because-
didn't have, I was planning to have that participant.
And I think why that was so important to me and why I answered that way is because I knew how important it was here to get us even a focus. Because what Lee was talking about, where we were just throwing money out in the beginning. Our focus on where we were supposed to throw money, and it was.
I think that
it
the
was
plan
more
is.
about-
Y'all were, y'all didn't want to look at it. I think y'all done all this, y'all got all this money.
Nobody's putting $1 out in the community, and yeah, it was hard.
It's not as a separate.
And we were doing it with half a board.
That was not a
for
criticism.
A year.
Cheryl, that was not a criticism, that was an observation.
No, it was horrible. It really was horrible. That's what I was telling her, that when we were doing the ELC board, one of the things I had noted is we didn't have a strategic plan, but just before we did.
No, so I had like.
I'm gonna still be red. You're still red.
Was gonna be just.
You're still red.
Like, oops. So I had to totally shift gears and.
But it was good. I was glad we thought. I mean, I think that's so.
Actually, it worked out. I mean, I can put things in the, this is what I think will look like, because the big approach.
And I still, my only criticism is we didn't follow some of the after school program. I know, and I give others are, and I would hope we have a follow-up workshop. Just keep on trying to give her the right. I want to vote.
Focusing on just.
Yeah.
You said it could be in the staff. It's all about what.
I think that's good.
Yeah, but it's been on a lot of things. I want to. And again, we did all this up and down. And our intern, and so it's.
I call her Helen now.
Even better. Like, yeah, I know I'm gonna be out of it, and I'm like, how, like, and I have lots of stuff. I work with all seniors, so I.
Kayla.
Absolutely. Okay, yes, one second, staff, hold on, staff.
We did a lot of talk and we spent a real focus of ours about
That's why I
literacy.
haven't.
But literacy is not an area of focus.
Okay.
That's a problem, and I can't put any dots there.
Okay.
You want me to recognize her?
It's not in the current. This is your current areas of focus. Now, we're going to go and talk about some additional priorities that we heard from you through the process, and literacy is there. So you're going to vote again, but now we're only dealing with the current areas and the red, okay? All right, and then after the board finish, staff is going to vote with their yellow stickies only.
Oh.
Your
good.
yellow stickies only.
They're gonna show us how out of touch we are when they fix it. Right, Helen?
You're right.
Right.
Like, okay, we're here to show you how.
Just not supposed to be done, you idiots.
That knows what's up.
You would never say it to you like that. You remember our name.
Yes. You're right, Helen.
I know.
Or should be forever Helen now.
So when you were a provider, once a week for a year or so.
Yeah, at least once a week.
Yeah.
Yeah. Who in that is at the door?
I'd be glad to hear both sides of every case.
Tina's been up there for like, is there a time limit? Cause Tina's been up there for like 4 hours.
So I'm feeling this.
We appreciate your intentionality and select. Okay, staff, you go for it. Try not to put one on top of a red, where I can not, you can put it on top, but just not cover the whole red.
That way, you know, they pick. I like, well, or three. So. Pick your three.
No, I mean, one. If there were enough on there, you could put all of them.
Yeah, there's 14.
I just shook.
It's heavily. Heavily weighted to the top.
It was.
You were talking about, place anyway.
So there, that.
Karen Cole. Karen Cole.
No, but I have. We gotta have that.
Practical. Yeah, there is.
I think they would. But don't you? The decisions you make with your dogs are totally different.
Yeah.
Yeah.
Without, I'm with.
Without that.
I'm here.
Yeah, I kind of feel like she's like, it's her
Yeah,
road for the universe or something.
It reminds me of like a grade school, like, as,
It
you know.
did remind me of. She could wheel it over there and she could
Yeah,
sit next
it's
to
mobile. We'll travel.
find somewhere out of the way next meeting. But if you were over there, we would. So, I'm trying. I say we put her over there by area.
Yeah, come sit next to me.
Gavel is amazing. Gavel is amazing. I will take that from you.
I don't see any that have been written changed. Didn't you say if you wanted to move one from one area? Oh, we're gonna do that later.
We'll discuss it after we add it up.
Sure, but mine. We got all of those last day. I think we're gonna
Staff has rewritten your plan for you. Staff has rewritten your plan for you.
Listen, and this is my problem.
A lot more thoughtful, they're talking,
That's it.
like, you know.
But it's interesting, their visions were all pretty good.
But I agree with you.
I know, but I'm sorry.
It was good. It was your team.
I'm making sure that the trust.
I told you they could, they keep me straight, they tell me what to do.
Yeah, I envision all new people. In 3 years.
Oh, that would be terrible.
We got Tom working on it.
Knees, yeah, me neither. I can't do that. Oh, a Malin?
here.
Okay, so while staff is voting, let's look at the next section. Can't talk anymore. When we spoke to you during the interview process, we asked you specifically about, as a board, what did you see in terms of priorities or areas of focus for the next few years? And we took the liberty of putting those that we could identify under one of your, that fit nicely under one of your goal categories. We went on and put them up there. But then, put them in that category. But then there was a group that did not seem to fit under one of your current categories, current goal categories. But there's some good things in there and it's important to the board, your board. So the next thing we're going to do is vote on these areas, both education and safety, along with all of the additional priorities over here.
Possibly. So they're totally in a different. Yeah. To me, the goal.
That's why we separated them,
Yeah.
because we thought so too.
These and the the proposed ones are all programmatic goals. Most of these are just internal capacity, either management of, business model. We don't get the renewal. We kind of did, So I think they're in totally different. Some are capacity operational versus programmatic strategic.
And we agree with you. That's why we didn't put them together. But what we have to decide is, do we make a different title for these?
Yeah.
Under the goals, or are these going to be strategies of some sort? What are we going to do with them? So that's why we pulled them out, because they did not fit under one of the categories.
And she's saying, I think they're internal.
But we need to make that decision today. If we're going to leave them internal to the staff.
A balanced scorecard approach.
Yes.
Practice and
Yes,
resource.
yes.
Lower tier than.
But the board needs to make that decision and say to staff today, this is how we're going to handle those. Okay.
So we might split the votes and let 7 greens go to.
Only have
Would that work for you?
I only have 7.
No, I only have 2 of these. No, I'm not gonna be, not again. No, I have only got 2 strips. Okay, what's she saying?
So we have to give you another strip?
Yeah. Yeah, she only.
If I need it, I only have 1. I swear.
You have 2 strips of green and Dr. Hardy.
I had 2 reds, only 1 green.
I doesn't want to get accused of hogging somebody else's Snickers again.
I would say, I already know, you'll take your red.
And you sold Cheryl's strip? You sold Cheryl's strip?
Yeah.
No, I only
Hey.
have 2.
I got a black market.
You got an extra one?
No, but
He's already.
my dots are up for sale.
Okay. All right. So what we're going to do is your green dots, you're going to spend 7 of those dots on the educational and safety focus that have been already put in those buckets. And then the other 7 on the general new ideas. And then we'll talk about how we handle those new ideas in terms of.
Yeah. May I recommend that we just put.
He doesn't want to allow for stacking.
Stack them.
I like stacking. I stacked all
I
mine.
like stacking.
Then we see what the priorities are.
Well, by person as opposed to just by weight.
Right.
But you can do it. By number or weight.
I think that because we did it the other way for the current
Some
ones.
people just put 1 per thing.
Was that you, Lee?
Yeah.
Don't spend it all.
Then I have a whole script to sell.
You done bought it.
Now, where are these on the wall?
Right here.
Top.
This is the top and then the education safety is at the bottom.
Got it, okay.
Right.
Top, one strip on the bottom.
so sorry.
Let's have Tina go first.
Okay. So the green, okay. I'm already here, you go here. 'Cause I can sit here and-
Mary.
We
One
interviewed,
strip up here, one strip down there.
when we interviewed them, we asked the question about your priorities. Those priorities that you told us, some of them nicely already fit in your education category or your safety category. We didn't really have any that fit in the health category. So we went on and put them in those categories. That's where you slide educational and safety over here. Then there were those general ones that didn't really fit anywhere. So those are the ones in the triangle.
Yeah, because without that.
First two are at the bottom. So these are at the top. So you're gonna spend 7 of your dots on the education and safety. Then the other 7, the general, okay?
Yeah.
Nancy, are you back? Do you have it in front of you?
Can't help it if you're easily distracted.
So you don't have the dots, but you can make note.
Africa, she put it in the chat.
Like they're all great, and you wanna say. You can make note of which ones you prefer, and we will get that information from you. Balance each other as we collectively put all the
Put it in the chat.
together. Or if you want, you can put it in the chat. Whichever you prefer. Did you understand the directions? Okay. I can't hear you.
I have 7 dots, right?
Yes, for this section, you should have 14 dots. 7 of them are gonna go under your education and safety focus areas, and the other 7 are gonna go for the new stuff that doesn't really fit in the goals now.
That's how I do.
And this, Nancy, right now, we're on the additional priorities to consider.
I used to think about.
And I'll go back with you because you missed the first part about the current areas of focus. I'll go back with you on that in a few minutes.
I always used to think, but that is like the best. Predictors of attention. So the gal.
Lee asked the question about what is fragile schools. That came from one of your board members saying that we should focus our areas, our efforts on those schools that are considered fragile schools.
So Lee, what fragile school is one that have 1 year, go to.
Gotcha, thank you.
That might have come from Tina.
177.
I think so. Oh, but it might have been.
I think I said something like that, but in a different way.
Also, we know where are we from. You know, I was getting ready to say, yeah, I should also maybe like that.
Like this song is there.
No, they said that all we should say. And people like, yeah. And then you can do.
Had the whole thing about leave poverty, that they said we could solve poverty enough to go away.
You put them side by side.
Measure on the dots. And childhood trauma,
And address.
all kind of the.
Well, but you've got reading and academic performance, you've got,
Those go together.
Yeah, they do.
it's one or the other, I mean.
Literacy.
I would combine those.
Yeah.
I kind of violate.
Your jobs are really nice. I'm just saying.
I don't have personality and I'm very smart.
Spanish for I have like tons, so I just cut them into 4.
And use them, right?
And I'm supposed to my dog.
Yes.
Actually, I see you got the pictures of all the board members up on.
Well, they are up.
There.
It's taken, well, it's hard to find we're trying to find a company that will do, you know, a nice presentation. So the person like kind of realize so we're trying to find that. So at least when they walk in, they see your lovely face. There you go. But eventually it will look a little better. Oh, so Jakayla, Kayla, Jakayla, she's back here. It's her.
Make sure she has a microphone in front of her. I call on her.
She's the quiet with Jaden. No, he's not here. You'll love Jaden. Actually, that's a good idea. That's all.
Yes.
Perfect. Perfect.
Nancy, we're almost done with the dot exercise and we'll be back to it.
I don't. Just super tall.
Are we almost ready?
Her hair was great, braided in.
Jackie?
So, you know. That's warm.
And we get the stair credit?
I'll get this chat. I will come
They have
and I
something to
said,
tell me?
and I want them to help with this stuff. I have not.
Hey, staff, listen up.
Yes, ma'am.
Y'all ready to vote?
Yes, ma'am. You already voted, didn't you, Marsha? I didn't vote.
We have to get.
Oh, I forgot. I'm supposed to.
No, we just had that conversation.
I know. And I forgot that quick.
Okay, she's typing out her.
Staff put it up for
Yeah,
you.
the same colors.
I'm supposed to be doing.
So, Nancy did not vote on the current area.
So Marsha,
Don't, Marcia, are you? Okay.
Are you doing this?
Priority.
Oh, I'm just, that's what you.
Oh, okay.
It's a little crowded. It's a little crowded over there.
So are we gonna put there for that? I think I got or leave that there. Do you want us?
That's up there for Nancy?
Well, she's sending us where she would put.
Okay. Yes. Go get.
No money, no mission. Well, this racer was not wrong.
Time for a dollar.
Hey, staff, now it's time for you to. Now it's time for you to use your blue dots as soon as, finish.
Put it on this.
And did you hear the instructions before? You have 7 that you're gonna use on the educational and the safety, already in the category, and 7 in the triangle. They're listed on the wall. So 7 and 7. And your blue dot, your blue dots only.
We've decided they're kind of together. One category.
Well, no, preventing it.
Keeping it from ever
Address the
happening.
issue, we have to have prevention. Tertiary, primary, tertiary, and secondary, to be like, really school about it. And I really like that.
Trump's original is okay.
Yes, it's like primary, that's primary prevention, it's like it never happens at all.
That's what I worry about with all these federal funds.
The last one property, then the guy. Claudia has the same issue. Oh yeah, I hired, best hire I ever made.
Really?
Absolutely. Best hire. And I still mentor her. She was the person in the chat. We're doing right now. Okay. We started out as a bank manager years ago, and then I hired her as our, Donna became CEO.
Those are for Nancy.
Oh, okay.
That's the right color.
Ellen, calm down.
She hired me, didn't you?
Am I the only one who wants to lead and? I would give you anything.
Can you imagine?
Oh, yeah.
As a teacher or.
Like a building Madison? Oh, yes. He would be back in time and watch, he'd be the kid with the hand in the fish bowls.
Sushi.
Sign on the back of somebody.
I'm like,
My,
where's,
Oh, that's good.
my husband scaled his
I'm
brother.
like her, I'm like her, I'm quiet.
He was a little. The goldfish had a name. My husband scaled it because. I wonder why they still don't get along. And old men.
That's the thing, I always have like whole conversations with myself about being quiet, and then I talk.
Very well, my partner, you're nonverbal. My mother is in the flower.
Find random pink shoe, purple shoe. So funny what we do as kids.
I do, like, tell myself, be quiet, don't do this, don't do that, and then I do all the things I told myself not to do.
What color should the sample be?
That's it, self.
Maybe you need the gavel on your side. We have extra.
Yeah, get it, you can get them from Conchita.
Okay.
Oh, what Conchita did. I think Jackie.
Okay.
That was great.
You can't sell your extras. One of the rules of dots is you can't sell your extras.
Lee's over here hawking green button.
Not sure the attorney Lee should be next to me.
No, they shouldn't.
No, I think that's not a good idea.
Katura, can you roll your desk away from Lee?
Are we not allowed to sit next to each other? Really not. I think that's gonna be a new rule.
You have too many dots in there.
All right.
So I feel like we need to put a timer on, yeah.
Yes.
You all.
Okay. So as got this section. Um, let's look at, Conchita, are you? Okay. We're just gonna tell you what you basically did on the first section, okay?
Okay, let's,
So let's listen up for that.
Jack, you have the floor.
Get my microphone. You want the first one? Oh.
Oh, thank you, Lee.
So. One and two, dark span, right? So for one. Cheating, the bottom number is what, yellow or something?
Yeah. The total. Okay, that's the number one item, and that's the number two item. Number one.
Okay, gotcha. All right, so for your current areas of focus. The top vote getter was maternal child health programs. A total of 28 votes, 15 green for the board, 13 for the staff. Your second was family resource centers with 16 for the board, 9 for staff. The third had a tie of care coordination and navigation services and VPK outreach and messaging. Care coordination and navigation services had 8 for the board, 14 for staff.
That BBK was
Under goal 2.
under goal 2.
Yes, it is.
Okay, so we're over to.
Okay, so let me back up then. For goal 1, okay, let me just stick with goal 1. Goal 1, your top was maternal child health programs
And family resource.
and family resource.
And then 3 was
And
care coordination.
then 2 for number 1 was family resource, right? Okay. And then 3 for number 1 was care coordination and navigation services. Okay. Gotcha. And 4 for number 1 was system of care building. And 5 being access to comprehensive care.
Okay, may I ask the board a question? Why was access to comprehensive care not more important? Talking about healthcare, and so why did that rank so low?
As opposed to
Opposed to,
all the care coordination and navigation.
I'm just curious.
It'd be hard for us to fund direct care. A navigator that helps somebody access the best care available to them.
Or identify
That
the
was my
right,
thought.
yeah, the right
Because I voted
service.
for it.
All right, that's a good explanation, thank you.
Yeah, what's curious to me is that staff had 14 for care coordination as number 2, and they.
Board had
it's
8.
Only 9 compared to the board, and I wonder if staff has a feeling about. As effective, or if that. 7 stickers, yeah, maybe that's it.
That's not a one-to-one.
And you all can tell us how you want us to consider these. I mean, if you want to give a different weight to the board versus staff, I mean, that's.
No, I don't think so.
Okay. All right, so
You give the
board list weight, okay. So number 2, go, yes.
I thought, Tina, were you saying something?
I was asking if she
Care and coordination and navigation services, 8 for the board, 14 for staff. 8 for the board, 11 for staff.
Maternal health.
Maternal health, 15 board, 13 staff. For your second goal area, number 1 was quality early care and education, 14 board, 8 staff. Number 2,
Out of school time activities, 7 board, 10 staff.
number 3 was VPK outreach and messaging, 12 board, 12 board, 4 staff. And then number 4 was mentoring and character building, board, 3 staff, low score. And 5 was community advisory board.
1 board.
With 1 board vote. That's the order it fell. Now, my question now is, are there any of these current areas of focus that need to be moved? Jackie, you don't. Oh, okay.
Still counting.
Okay. I'm just trying to keep it moving. Gotcha. Are there any of those areas in 1 and 2 that needs to be moved? Okay, she just did 3, so I can go over that with you. All right, so let's back up. You thinking? 3, number 1, out of school activity, out of school time activity with 6 board votes and 4 staff. 2, community safety convener participant, 6 board, 2 staff. 3, mentoring and character building, board. And what I said, 3. There was just 2 board, no staff. On mentoring and character building.
So to me, that he had 2 pieces to it. The issue than a basically the rest of the program, like gun violence prevention. Talk about it. I saw those as 2 separate.
Right now, they're lumped under one. Okay, just a minute, Nancy. Do you want to separate those as a board, make that decision? Nancy?
Hi, can you
Hi.
hear me?
I can.
I'm totally confused about what you're voting on because what I have on my screen is for future consideration ... educational safety areas of focus and then
She was.
a big square. So I cannot see what document you're working from.
Okay, you were not on when we did the first set, so I will
Go back up a
go,
slide. Yeah.
go back up a slide. There you go. These, Nancy, were your current areas of focus under each of your goal categories. So what we voted on was a priority ranking under each one of those. And now we are going to talk about if any of these should be moved, deleted. There were some that got low scores, moved to a different goal area, deleted, or open discussion on those. We're on your other call when we did these, so we did not vote on those, but you are welcome to add to them at this point if you like.
So how many votes do I have now?
You now have 14 votes.
14 votes in these 4 boxes, including box number 4, which is capacity building.
Not before, Do not do 4, just 1 through 3.
Oh, okay. So
Okay.
do you want me to put that in the chat? Will I break any ties? I'm sorry, I couldn't even follow the conversation about who voted how, so.
I'm not sure, but feel free to put it in the chat. Yes.
Okay.
It would appear that the community advisory board talked about mentoring program. But it didn't seem like. So,
One vote for community advisory board and 2 votes for mentoring. Yeah, only 2.
not have staff spend a whole lot of time to learn.
Remembering that we have a $4 million.
Not funding it at all, at least for a year.
Provide money this year for outreach and
Folks who did do the mentoring to talk about what it could look like. And what did we say, 50,000?
Yes.
50,000 to prepare for fiscal year 27. And am I correct by thinking that the changes we make to this plan will be to start fiscal year 27, 26 through 27? Because we've already allocated funding for 26. Okay, I just wanted to say that out loud.
All right, so what am I hearing? Am I hearing that we are going to?
My only issue with that, Lee, is Nancy and I think the whole board really agreed that we are short on safety and only 2 other categories on safety. I don't know if it's because we don't know. That was that. Hate to eliminate stuff out of that category.
I think out of school, we're gonna find.
Okay, so maybe that's what that is.
Yeah. The thing with mentoring.
Group mentoring, no one-on-one.
But
They're
just some,
preventative.
there's some, but they're more prevention than don't have anything under prevention.
And that is one of your
Yeah.
guiding principles.
So I would almost say that added as a prevention / mentoring, but no. Part of the next cycle, there's gonna be a planning. Without, but not yet funding a program for it. I would see that.
I was saying the same I was saying the same thing, that we go ahead, have, hopefully not waste their time, but get information about it. When it comes up. Y'all give us, or it's whether you think it's worth.
In addition, I want, I say, Dr. Hart, in addition, don't forget you had 3 on safety that came up through the interviews as well that you may want to tack on.
That may
We
be
have
right.
not addressed those yet. Dr. Hart?
I can't see what those are. I just I'm not thinking of mentoring and character building as being a safety area. That would be educational and thrive to me out of school time activity. I'm not sure that's a safety area. What happened to all our childhood trauma meta programming or whatever. I don't know what happened to those items.
It's coming.
Yeah, so that's coming in the future item, so I think you're honing right in on it. Yep.
Yeah,
So I
don't know.
guess I'm saying I'm not interested in any of these 3 as being our safety areas of focus. Not that I hate them, I just don't think that's where we need to focus.
So, Mr. Chair, would we like to eliminate the commute whenever advisory board?
aren't spending any money currently.
It's really just taking it out of this plan.
So
I'm
we're
okay with
taking
that.
out Community Advisory Board?
Anybody object?
No.
Take that out? Strike it.
And I would say that mentoring, for me, mentoring and character building actually are a health area. It's children well-being, nurturing, care for, and I would put that as a prevention, because mentoring is really a subset of prevention. So I would that would also give the staff more direction to be looking at this broadly than just mentoring.
I think we already have it in education. Why don't we just strike it out of safety? Check that.
But again, I'm not sure it belongs in educational. Mentoring and character building prevention programs are really health-focused programs. They're well-being, they're wellness and well-being programs.
I apologize again. So where we put,
As a subset of prevention, and for me, it would go in goal 1.
Mental health.
Yeah.
Yeah. Christy?
I have a question just because I need a little bit of guidance. When we wrote the RFP for mentoring, there were pieces of it where we were focused on preventing referrals and fights and juvenile delinquency, which is why I think it also landed in safety, because that was also, what we were trying to prevent. And with that being said, do we still not think it is safety?
It's better in safety, in my mind, it's better in safety than it is in education. Unless it's academic mentoring, which is really tutoring. And it's not.
Well, it only got 2 dots from 2 board members, so can they still?
I didn't.
I did. But I was thinking of it more broadly as prevention, as a prevention area.
That's true. We also, Christy and I had green dots. I did put it in. I did.
Yeah, so I think, I just, when you can
go. They're the culprits.
You can go back and forth about whether it's a safety, and yes, you're preventing delinquency, but those are outcomes of what? Low self-esteem, da, 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 da. So I would, in my mind, prevention is a health thing. It's not like we've got a plethora of things under safety. So.
But I think we're going to. I think that's.
Yeah, we may. Yeah.
Well, we don't really have to make a decision in this, the recommendation is y'all come back and just y'all give us your input next year.
Yeah.
So that is mentoring and character building that we're speaking of, correct?
Correct.
Okay, so staff is gonna come back.
On all of this, they'll consolidate.
And I said, oh yeah, I did put my dot there.
Anything else we need to pay attention to before we move on? Nancy, yes. Nancy,
Yes, I'm here.
have your hand up.
Oh, sorry, I need to put it down.
But she has stuff in the chat that we.
Okay.
Yeah, but I think all of that is in the next.
In the next.
Basis is trauma.
Okay.
Okay. All right, so for future consideration, let's look at those scores.
While y'all are doing that, one thing about final seat,
No, I think that's just an operational, run the agency. You can't run the agency without one.
You cannot.
Let's not waste any more time talking about that.
Okay. It's gone. So for future consideration, in the bucket 2 and bucket 3, so in education and in safety, the number 1 item is address literacy with 16 board, 4 staff. Number 2 is reading and academic performance, 12 board, 3 staff. Number 3 is facilitate enhanced involvement between schools and their students' families with 4 board and 2 staff.
And then programs focused on the fragile schools, we got 2 board members to vote on that one. So number 1 was address literacy, number 2, reading and academic performance, number 3 was to facilitate the enhanced involvement between the schools and their student families, and then number 4 in that area was programs focused on fragile schools. In bucket 3, safety.
Before you go on, Ms. Robinson, so is address literacy and reading and academic performance the same thing?
Same.
So can we combine, I mean, they both got 1 and 2, so that's clearly our highest priority.
So in the safety area of focus, the number 1 item with 20 combined votes is addressing childhood trauma, 13 board, 7 staff. The number 2 item is address issues of youth and guns, 6 board, 4 staff. And preventing trauma, 1 board, 6 staff is item number 3. So number 1, addressing childhood trauma, number 2, address issues of youth and guns, and number 3, preventing trauma. Yes.
That there's, like, they think that that's pretty important.
Well, I mean, I'll say I was a board member that did preventing trauma, but then Maggie convinced me it's really the same as addressing childhood trauma.
I mean, we could just make one item that says
Prevent
prevent
and
and
address.
Yeah.
I think if we combine those 2,
Yeah.
we're gonna capture staff and boards. That would be 14 and 13. It would be overwhelmingly.
That would be the number 1.
Dr. Hart?
Did you count my votes? They were in the chat.
We've made an impact today with the trauma stuff early, because it's obviously getting put in.
So we collecting ACEs, so are we pulling this data so we can?
No, look at my original votes that I thought were what we were voting on when we were voting on the other
We
slide.
did. Hers was, yeah, we incorporated it.
Okay.
Somebody here put her dots up on.
Thank you. They said they did. Were you surprised by something? Is there something you think should have been higher ranked?
Well, I just am not really, when we unpack the literacy issue, and I read very carefully what came in the report from the Lastinger Center, it sounded to me like the problem is not so much at the schools, it's between the schools and the students' families. The students' families seem to have no awareness that they actually could improve the situation of their children unless they just happen to luck into one of those reading programs that's been so successful. And that's why I put all my votes on facilitate enhanced involvement between schools and student families.
So I would see that as a strategy or a tactic to improve literacy, is making the parents and so I don't see that as a separate goal. I think if you want to enhance literacy, one of the strategies is liaison more with the parents, so that
Parental
parents
involvement.
become aware. Yeah, it's an approach to improving literacy rather than an academic performance, rather than a separate goal.
Now, when we looked at the additional priorities, mostly internal, that needed to be worked on, number 1 item, of course, is renewing our special district designation.
I'm shocked.
Which had 13 board and 15 staff, so that was clearly number 1. And number 2 was adhering to strategic plan on funding, and that was 11 board, 10 staff. The number third item was grow partnerships and collaborations, businesses, workforce development, higher education, healthcare, school board, I'm sorry. And that was 9 board, 11 staff. The 4th item.
No, I'm sorry, I can't count. Okay.
The 4th item with a total of 11 votes, 4 board, 7 staff, was measure impacts.
That's the one on the screen.
4 to 7, 4 to 7 equal 11 for the fourth measure impacts, which is 4 boards, 7 staff. The next one, item 5, is meet with other funders and collaborate. Facilitate workshops and other funding agencies, city, county, schools, stakeholders. That had 3 board, 5 staff. The next item was focus on older youth preventative programs. 5 board, 2 staff, making it the 6th item. Have done away, and we won't mention again, getting a CFO. So the next item is strategic plan should consider national, local best practices and events when prioritizing goals, and it had 3 board and 3 staff. Another,
Evaluate
the subcategories.
0, the evaluate subcategories on the 3 goals pillars, 0 votes, no staff, no board.
Yeah.
Yeah, that's what we're
Everything
doing right
is what
now,
we're
so
doing
yeah.
now.
So that one goes. I would say the prevention one goes under what we were doing before with prevention. These are all capacity kinds of things, whereas that prevention one really does belong.
Where's the prevention one?
It wasn't the older, yeah, the 6th.
Oh, I got you. Okay.
The focus on older youth preventive programs, that just seems to me to go back over into the program bins.
Would you say, growing partnerships and collaborators and then meet with other funders and collaborate?
Yeah, yeah,
Combine those?
those
They
combined.
yeah.
Which ones are you combining?
3 and
And
5.
5.
Hold on, wait. 3, 5, which is meet with other funders, so grow partnerships and meet with other funders, combine those?
Yeah.
Okay.
I was surprised to not see, any type of addition for children with special needs.
Are definitely lacking.
On the list.
And again, I didn't hear you.
Yeah.
That was our writing. We wanted to write. Yes. I think it continues to, there are children. And so I think, I don't know, I'd love for us to be more intentional about making sure that there are services for those families. This summer, dedicated, right? This summer is our first time really being intentional about making sure we funded those. And so we have 2 fabulous summer camps. And so it's just something that I was surprised that was not on the list.
I agree. With you, Chrissy, we should be more intentional. I think when I gave my responses to my interview, you're thinking about what's top of mind. And it actually just slipped my memory. And now when you said that, I'm thinking about the dad that came when we were on 5th Avenue, when we were located there. Came a couple of times to the meeting talking about that. So I'm willing to add that. I don't know where we would put it, but I do think that should be something because it is a large demographic and those families do have a high challenge of finding support services outside of school for those.
That's something that could be one of those meta, because it crosses all 3, it does. And so, again, if we're thinking about supporting providers to be better, including services, how to be inclusive of special needs children might be one of those areas where we want to.
I think it should be its own thing, not just, it could be meta, but I think it should be its own, because I know I got a call.
Well, that's what I mean, meta, but meta to me has, we've identified trauma, we've identified several things that we consider meta, and I would say that's its own separate category of the meta funding kinds of things that we ought to consider. It goes in the RFPs, right, for special.
It goes in the RFPs. We have a great relationship with some of the organizations that train our providers. It is inadequate for a parent to want to put their children in a summer camp where, one, I feel like maybe it's an afterthought. they don't have the capacity. You can sit in a training all day, but until that child is with you, we spent an hour or two at Limitless Adventures yesterday, all children, most with severe special needs. They needed to be in that camp with those individuals who had the training and were only prepared to take those children because they had that specialized training. And I don't think our other providers are just prepared to do that. I don't think it's fair to the provider. I don't think it's fair for the parent to drop their child off and not be quite sure.
I agree.
Does it go, I completely agree. Chrissy, does it go in health or educational area?
Well, or is it a goal or is it a guiding principle that we will fund programs for children with special needs? That way you don't have to, I mean, then you don't have to decide which bin to put it in. It's just a guiding principle that we will fund programs that meet the needs of special.
But how would they respond to
You build-
to a proposal?
But you can say that we will have in each of those categories, something for special needs that are specifically focused.
I'd also love to see it be its own pot of money, its own RFP, just for, not an add-in, not we're gonna train you. I'd love for it to be that.
In the process of discussing one of those RFPs, I don't know whether, I think they went through with it. I don't know if they got enough people. Also brought up the fact that, it might be necessary to increase.
The income level.
Not that, the funding, our,
It's the parent's income, the federal poverty level.
Lower taken care of, the people who are higher can afford it, the one in the middle, it's tough.
The
because
donut
it's
hole.
more expensive.
We may just want to say that in each kind of funding stream, we will have an RFP that allows for a separate response for somebody that's going to be solely focused on special needs. I think we said need that the guiding principle number 5 is about gaps, meeting the gaps. But it doesn't specifically say, and you're saying, I said just make that as a funding principle, but then that, which then guides that within every category, we will fund something specific for children with special needs. That would be, I think, because I don't want to say it's all in health. It could be in activity, it could be in somewhere, it could be anywhere.
Christy is, in looking at the other children special districts around the state, is there one that stands out or two that stand out that really has this focus?
Yeah, the CSEs. So we've done a few asks, and I haven't seen one that really stood out. But we participate in the program affinity, research affinity. Bonnie does a great job at doing that, and we'll keep looking, but I haven't seen one that really stood out yet.
That one then, okay.
All right, so we decided to put special needs programs where?
In each category.
Yeah.
Category, so it's gonna go under meta. It's gonna be under the meta category.
Yeah, no, I think we said we'd make a commitment
Make
to
it-
fund,
Right.
always fund something, because it could be in any of the goals, but it could be targeted.
Okay,
But to make a guiding principle.
okay. Oh, you're gonna put it in the guidance.
Anita Zuckerberg
Oh.
School has
Say that again, Ken.
that.
It might be what it's called a PAT.
Last time she passed out that book.
Yeah. And then next, you're gonna call Pat for that 3 weeks.
I kind of wonder if we need, because this is like, it's universe all unto itself. If, just like with mentoring, you need some time to research what else is out there and collaboratively, not just the other trusts, but like the Able Trust, for instance, vocational rehab, they have funding and things for youth. They have youth programming. I'd love to know what they fund, what they don't fund, what they think the priorities and gaps are. And it seems like there's a lot of learning to do. I mean, it's great that there's a couple of after-school programs, but if you're going to look at it overall, it seems like there's some research and learning to happen, especially if we're going it ahead of other colleagues around the state.
I do agree with that. I think what's positive is that this is for our fiscal year 26, 27. So it gives us time to, we're not in a rush to put an RFP out. We can do some more research, like you said. I agree with you 100%.
Yeah, makes sense.
We have some new staff with some expertise in that area.
That's right.
Got a percentage set.
Yeah.
Not going now.
We'll get to the money.
Get there.
We'll get there.
It's early yet, Lee.
Hey,
Carving some money.
hey, if y'all haven't learned, I'm nuts and bolts, okay?
All right, before we move on, I just want to recognize one of our special interns that's joining us. Kayla, can you just stand up so we can all see your beautiful face and give her a round of applause? I was gonna ask her to provide some input on this last session, but she said she did not want to do that yet. Thank you for being here. It's really important to have you. Yeah. Much of the reason of why we are here.
Okay, before we move on, are we good? Are we good with? Thank you. Before we move on, are we good with the focus areas being where they belong? Okay. Great. Thank you, thank you, thank you. Okay.
Poor Regine.
I don't know how to move on.
Oh, it won't let you. O'Malley, can you help her move on, move to the next slide?
What was the tipping point, the brisket or the chicken?
You mean so how much we are like to deal with.
So we want to spend a little more time with what we've heard. And so we want to break you up into the 3 goals and our new goal here to support success for our provider community, which is a totally new goal, and really talk about the how-to. So what I'd like you to do is open up one of your notebooks and start jotting down some thoughts of how we might, the staff and or the board or the community will move forward in getting us to that 36-month goal, see? Because remember, we've envisioned so we can get there. So now that we're kind of cleaning this up and saying, these are the places we want to, how will we? Because the board, the staff needs to know how to go about doing this. They don't want to make the wrong turn, right? Or they want to share with you what they should be doing in 6 months.
I don't know if this was intentional, but just looking up on the screen, it basically just asks Nancy Hart because she'll tell us how to get there.
And then we'll be there, right?
We're all trying to get to where Dr. Hart is.
Nancy can see where she sits on the.
If she could just tell us, that would speed it all up.
Nancy, do you see yourself on the screen at the top of this ladder?
Nancy, are you there?
Might have stepped away.
I actually have a Nancy question.
She's not there,
I don't
I
think
don't
she's
think.
there.
I think she stepped away.
I do think it'd be helpful for us, because language matters,
Yeah.
to have a common definition of what we're talking about with meta programming in particular. And I think we've gotten clarity on capacity building for providers, but
So as I've understood, oh, there, Nancy's back. She just raised her hand.
questions to you, Nancy. When you talk about meta programming, how would you define that?
Yeah, so here's the way I see it. We have certain goals, like let's just take ACEs in Motion because it's a great example. Aces in Motion, as we know, is an athletic program, and they've stretched beyond their comfort zone to try to address other issues at our behest. But when it comes to things like identifying trauma in the children and figuring out what to do once it's identified, it may be a lot to ask of a program to take that on under the budget that they've come to us to request. So the way I view metaprogramming is we have an expert on teaching about trauma-informed care, teaching children how to identify potentially traumatized peers, teaching children how to talk to their camp counselor or their coach about trauma that's happening to them. And I see that expert as being funded from a separate box of money than the Aces in Motion money that Aces in Motion has come to us for. And so our contract with Aces in Motion, I'm sorry, I'm just using them as an example, Tina, that our contract with Aces in Motion would say, you are required to allow this third party in for, 1 hour a month, or something, whatever is deemed the appropriate amount of time. They don't pay for it, but they have to allow it, and they perhaps have to accept the training themselves. That's what I'm seeing as metaprogramming. We have expertise in this community, but it's not at Aces in Motion, but Aces in Motion will allow those experts to come in and help.
Thank you.
I understand.
Do you want to add anything?
No, that's exactly how I've understood it. And it could be, I mean, trauma has been one of the ones we've identified, but there are potentially other things. Mental health.
Safety, like.
Right. And we've done that. So like we were offering CPR, I think, there's all of our programs are allowed to benefit. So I think when we say meta programming, we need to list what those are so that we're aware of what it is that we're offering as supports. The CNE membership, and all of those things are the supports that we're offering.
So what we want to do now, and does everybody feel comfortable with the meta definition? Okay. I want you to select one of the goals. I mean, not everyone in the same goal, please. Select the goal you're going to work on, and what we're going to do is we're going to start capturing all the ideas. Now, you know all the full focus areas, and the top 3 Conchita has listed here. Obviously, we have to tease out all of them, but where you think the staff and the board should be doing to contribute in each one of those areas.
I have stickers to sell.
More activity, more activity. That's why they fed you well. So that way we can do all this work. Brain food. And so we've listed the top 3, but we're going to break you up into 4 goals, and we're going to have you working together in your group. So I'm going to start with the chair and ask him which goal would you like to focus on?
Top one.
The top one? So you want to do the health? The health goal with all the focus areas in health. Anyone else going for health? Nancy's going to work on health. Nancy? Dr. Hart?
Am I assigned to health? Because I can't even see what I see is brainstorming. Health isn't even on here. So I don't know what my choices are.
So we have 4 goals. We have health. We have education, or thrive is the pillar, I believe. And then we have safety, and we have this new goal, which is support the success of our provider community.
That one's in favor.
Okay, so we have someone for number 4. You'll do number 4? Tina? Education, so we have education. Anybody for safety? Okay.
Yes.
We need one person for safety.
Yes, I'll do safety.
Okay, Nancy's in safety. Cheryl, you're in education? Health, okay.
Tina, you're gonna earn those blueberries.
All right. Marcia and Christy, where are you?
We'll do capacity.
Okay, oh, you're working with Maggie.
Oh, okay. So does every group have?
Does every group have at least 2 people?
Had safety.
So the first thing I want you to do is work individually and kind of jot down your thoughts before we actually start the exchange. And we'll give you about a little over a minute to jot down everything you can think of that we can do in a 6-month period, a 12-month period, 24. How are we getting to that vision, that wonderful vision that we have? The people walking in here and seeing all these providers. So ready? If you would jot down every idea you can think of that the staff and the board can do to begin to build ourselves to a 3-year goal. And start wrapping up.
So Nancy was safety? Oh, so Christy was gonna work with, safety. So didn't we have a computer for Maggie? I mean, for Nancy.
right here.
Uh, Oh, that's true.
Yeah, do a breakout room.
Okay.
Okay, we're gonna bring you all in your group. I think we have all 4. We have health in the back. We have education and thrive over here. We have safety over here and capacity building with the support of the success of our provider community over here. If you will come together, bring your Post-its. We'd like you to put your ideas in your 6-month, your 12-month, and your 24-month goals in the color of the Post-its. So we don't have to guess when something needs to happen. And we're gonna give you at least 3 minutes, no. At least 10 to 15 minutes to really do a thorough job on this, on what will it look like?
Public record. 6 months?
I didn't put mine, I wasn't thinking in terms of setting it in 6 months. I just was thinking of things in these areas that staff would kind of make it more cohesive, but I can make it at 6 months. Like when I look at the analysis, we have, you know, down here in the state, all of the state have something called. Hopefully, not here, but it's JJ. And so, and it's been right over like that. It really and it has a community network. So my thought is if we set up a people, all those national together and get this operating, that's a huge system that crosses years long. Not in the past, we need to have 6 months to have an initial discussion of that.
Right.
And the problem with
Perhaps your. Yes.
Finally, DCM, but I have to reach out to be really a DJJ system or figure out where there's a no run door where it's not that you call this person, it's I will call that navigator and then I'll say that activates for you.
Yeah, that's data. I wanted to see that it was.
Now, please be reminded that you have your top 3 focus areas already crafted on your goals up here. So you want to spend a lot of time on those.
Part of that.
Whatever.
We could have the trust work with.
See what happens if we say this.
Not literacy per se, but.
Or be not sadly,
I think by now.
So that's mobile. out there.
They're going everywhere now. They're off outside.
Dr. Hart, this is Keturah. In order for you to have your breakout session, we're sending you a separate Zoom link. Please check your email.
We have.
By our.
All the things because.
Yeah, so, okay, we can get that in the next 6 months.
And not to repel, it would also say help.
6 months. Okay. And then.
A lot of the, part of the area is have no kind of.
That's what's happening.
Well, and that kind of fits into how because when they do that, because they do some prenatal screening and things like that, they get a mobile. So, yeah, I think they're doing some of that now.
And that's why it ties in with the new east side hub. They're expanding in the primary.
They can make that initial cut.
Attention, all of our virtual attendees. You just received an email that says breakout and it has a link for your separate session. Thank you for choosing.
And then I still, like, I see we do these really good meetings where CPAC meets with county, CPAC meets with school board, about bringing all CPAC
Programs.
Training together
Implementation
to-
and impact. Gotten any training?
Yes. I sit on the United Ways, just for the impact of this, I see the cost come through and I say, and I'm very honest, but I also know what I'm funding here. Hospitals have never gotten here, they don't see what we're running with. So I think that stepping on. I'm not saying you're get all the plan, you know, we don't know that uses.
They don't know many those intergovernmental.
And anything.
Right, they talk to the. Yes, yeah.
About 12-month thing.
I think they could pull that. I mean, if we're trying to identify in 3 years how we want to focus our funding, I think it would be important that we understand the funding and what your methodology is for the city.
Whatever it is.
I've got a 24 month,
About like
which is
not knowing what's available for help.
county is doing a lot of stuff with food systems. Creating foods and local produce. County food.
That's for everybody.
I'll put that as a 24.
Well, I do think that's part of the, what we're gonna give the money to reach out of this literacy. That's what that money is going to do, I just don't know what it's going to.
You're talking about not seeing the her.
Correct.
So maybe, if I heard, what I heard is.
Intergovernmental.
If I had know what's available as many programs.
Funding
Thought
summit.
you were asking.
I was asking specific to literacy. There's just so many resources out there.
Right.
That on a literacy rich community. Or an, you know.
How to share the information. For that, one of the recommendations, there has to be hub, so that folks can go to the hub, and that's what.
But I think you could also push in the hub into programming. Like, hey,
If you are funded by the trust, here's this resource for you and for.
About,
That's all it has.
so the county has funded,
Think of GuideStar.
child vaccine programs for.
Yeah, but I still need to know that that even exists.
I think it's kind of.
Well, I think, so what's the term that is, what, just.
The health department.
Provides
County
programs that
every
are
year,
out there
like,
to support.
between those programs,
What they do.
vaccination for.
And then who's like, programs that they're already paid for. That reflects the
Speak
data.
about it, so the county is not going to be.
We've always funded whatever.
And, you know, and is it having an impact? And then.
And I think the state's gonna probably shy away from that. We don't do it.
What, yeah, how many have trained, how many are in implementation, and how many.
I don't care what. I don't know that that's down.
For me, that's
Their improvements. So, I mean, I think that's gonna be.
I don't even think
Be a 12-month one?
this whole next year, if
You need a perspective on it.
correct,
But right now.
Planning and health department on child vaccination.
whatever is available out in the full community. So,
Especially about kids supporting like. What they.
Very not receptive.
Whatever the methodology.
that's fair.
So what we're saying that is by 12 months.
And then I think we should look at how we're gonna incorporate it in still being motivated Programs, I think that's probably gonna be a month old, but in-house.
Contracted providers.
I see like comprehensive care, even coordination services. I do a lot of staffing with kids that are.
Or utilize.
A lot of reasons that kids say that crisis areas. Some severe disabilities. Place.
There are a number of
And
in the last that are really
parts of the state, they put out, I can't do it.
I think that they have.
And we work with staff. But it's amazing how hard it is sometimes to make that connectivity. So again, I think having a collaborative body. I call it like.
Can I steal your seat?
Come to our staff meetings just because they are our autism resource. The Center for Autism Related Disabilities. But again, got other people with other disabilities, how they connect me, and they understand how to work with medication, access additional services. So I don't know if that's a way to build this into health that we can, even our resource centers, we could even fund extra navigation specific to disabled. Special needs children. That could be that. Maybe fund a program with resource center to be a connector to disability services, special needs.
Because go back to that coordinated.
That is what I.
Our program bridge system.
A lot of them are.
So, and I was telling you.
I know, yeah, because they, those are their banks.
The other thing I'm just thinking, that I jotted down.
I know Nancy is working on. Working on targeted services for homeless kids.
And everybody's time is precious. I don't know how.
Primary care for.
Out there, not that.
Really.
Well, that's the liaison. The McKinney Vento.
What's it called?
McKinney Vento.
How we doing? Are we getting those 6 months goals? The 12-month activities? 24 months?
Would it be us? Maybe something.
I was me for a while back in the day.
Which is literally couldn't keep up. It's in and out at such a pace that. The hub is high level, it really is. So when I got down to the meta programming for 12 months, I provided, they're aware of it, provided.
McKinney Vento liaison with the McKinney schools.
And also that percent that are best.
We could end it, I mean, if nothing else, that could be 6 months. Educating, yeah, it would be, because if we're just educating liaison on how to then make it. That would, it's maybe the same.
Then I think.
Or they could also vice versa, give them the resources.
Just having completed a self. Yeah. As a 12 months.
All right.
I was thinking, do you think?
I mean, real living. Yeah, because I think.
I would visit Colton. Okay, so that, how long did it take you to go?
20 minutes. Really serve that. I don't remember what it said, but when they were talking about summer camps, and they said, well, you didn't have an option, you say, yeah. Or the other half.
Percentage
It's horrible,
have
it's just now.
rest area.
Right.
So it's one area, right, they have, an area after.
Sarah. But I feel like this is kind of a whole summer.
Well, I mean, that was one I wrote, help educate.
How are we doing?
Um,
How are we doing?
And a plan.
Do you need some more time?
Oh, sorry. You need more time.
I need a little more time? Okay.
Say that. And of
Maybe
that.
the, well, and the baby not here. Is there, but again, we've got the bus that's taking it to the neighborhoods versus them having to come to a clinic, so.
And so it'll be more complete, right? Put them up in 6 months, 12 months and report out.
Some other.
Need a little more time?
I think we're good.
You're looking good? Okay. A couple of your group will need a little more time. Do you mind putting it in the 6 months, 12 months, and 4 months so they can?
We did it by color of paper.
That was what I asked. Well, then when we take it back, we know exactly when.
And we were at 12 months or, yeah.
Yeah, so good.
We're real rural oriented kind of.
I love it. I love it.
I don't know why.
Then we'll have you report out and have the team.
Big national organization.
Yeah, thank you.
Yeah.
That'll
They
give you
have
time.
more programs. And
We developed a relationship with the fractional for
seniors to serve.
relationships in HR.
They have.
Now that I've done that, I'm back at good ideas.
My former supervisors was
HR stuff.
overseeing, and then she became like a national program director for it. I mean, that's just one example, but there could be, and you may not have a Kingsville.
I love
that, but
I do too. Sometimes you'll feel a lot.
you know, this is,
Yeah.
what's successful, what's out there, you know.
Yeah.
You know, I already have some great
And it was during
resources.
my vacation, like, I'm here.
Yeah, mine too. It's
I'll
on
come in.
commission break.
You
got me.
So right now it's.
All right, people are saying they need about another 3 to 5 minutes. If those that are done want to grab a bio break or whatever.
Or she draw a correlation.
Teresa.
It's the moving needle.
Here's it.
Much unknown about research.
All you have to do is submit the invoice. That's the direction you're heading.
Yeah, you can dictate.
Versus some, program that's already kind of worked hard to establish.
You're getting that, you're getting, right.
I have a really good. Let me get to that point, by the way, but it. Not costly too much. You walk by and check with,
I've done it a little, dabbled in it, and then you have.
just people start losing benefits. Right, so many things.
That you can legally get.
And it's like the
When
first,
do you need when do you need an audit, what happens when you don't pay your
Right.
taxes? But that's also part of the reason why we want them to go through. That's why we can hurt them.
Because they were trying to fit, their model into. our
So
model.
6 months, develop a selfie strategy. Yes. On CNE use, current CNE use, baseline. On the meta program, collect baseline on meta programs, how many have actually done any training? That's hard, figuring out how many
I have
are there.
a larger
And then
organization
assessing, also
serve as
asking
kind
at the
of a
same time
coach
about
and a
their
mentor.
Or
That might
programs,
be-
your local.
6, Lewis, 12.
Yeah, clearly right now, we've got.
You're the only one following the direction.
I'm not, no, I'm not.
It's like over 12 months on capacity, it's
Okay.
50% of.
So, I kinda like trying to
20% will have an action. And so-
got the starting.
And then.
Head start.
Like actually. 75%.
This is why connector is so important to me, because I get these random emails all the time.
I'm the tutorial. Yeah, I was gonna say. All right, by 24 months. They are often resistant. By 20, well, then they better get big ones this time. By 24 months. 50% with the plan, 25%. What are you?
Actually, December.
How about yours?
I'll be just under 37.
37?
No, CCF 37. In the evening.
Well, you're the ones that are gonna hear about it. Meta, it's meeting the firms who are aware of.
It is for large.
All right, now, okay, just saying. And that could be a trust or a.
Nothing like a little more time, right?
I still serve 13 counties. Life is one of my counties, but I serve it.
Not a fiscally constrained town.
Which kind of
Fiscally constrained town.
Hamilton's like.
Start.
Not right now. Like they look. My outfit is so loud.
And the cost, being able to read my. All right.
Have you walked for now and then we have whatever it's listening. Very fortunate. Yes, those are the things.
Oh, okay.
Oh, gosh. You see that when you go to your county. Progress meeting.
All right, everybody's wrapping up. We will be ready for report out.
And they keep going.
They're good, they're good. I'll just wait for you to help me change. What happens is when she. Puts away. Okay, that's why
Didn't know for fast enough. Too helpful. When the reality is.
So it's like, well, you gotta wait till you're ready. Right. Gotcha.
Oh, but I think that what that's.
Oh, they're back.
They are. Because when you go in and do their homework, showing us how many. Back. Did a lot of work. Consulted. Right, yeah. But say to bring us that.
Okay, can I bring you back? Can I bring you back? We would really, I just love the energy in developing these. Who wants to go first in reporting out? Oh, health. We'll go in order. How's that?
Okay, we'll go ahead and get started with health. Dr. Labarta, we're gonna get started with health.
Sorry.
That's okay, we're reporting out, no problem. All right, so we have a few things for 6 months. And we're gonna jointly report out, so apparently there, and I learned this today, there is a McKinney-Vento liaison in the school system for homeless folks. And so we think we can help connect with those liaisons to connect homeless kids with CTAC programming. So that was a 6-month one.
Okay.
Yes, so in the school system, this is a focus on homeless kids. And so the McKinney-Vento liaison in the school system, we could connect with those liaisons and identify potential services that some of the homeless kids could get plugged into with CTAC sort of programming. Also in a 6-month thing, UF has a UF mobile, health clinic. And it also, we could also connect with the health department to target certain specific areas that CTAC providers are currently providing services to. And try to connect them with primary care services. The Eastside Health Clinic is beginning to offer primary care services in that area. And so that's something that we could connect with in the next 6 months. On 12 months, we said work with the county and the health department for adequate vaccine, dental, and Medicare funding for kids that have that specific need that we're able to identify. That was a 12-month thing. And then Cheryl's got 3 of them.
Okay, then, another 12-month, we said, meet with all the key funders in the community, CTAC, United Way, county, city, et cetera, and have what we called an intergovernmental funding summit, just so that we could discuss funding priorities and how we manage impact or maximize impact. Make sure we're not supplanting, you know, I work on other funding organizations, most of you do. And I do see that sometimes there's a mention of, oh, CTAC will cover that. And so I think it's so important that we meet all together and have that discussion. Also a 12-month priority is possibly looking at funding a program through the resource centers that would serve as a resource connector to disability services for families with special needs. If work with them to maybe build that resource guide or list of resources where they really have a good understanding of it if they feel capable of doing that, but then have the resource center serve as a community hub for that. And then, so I was telling Ken that one of the state's big pushes is creating these navigators. You all have heard of Hope Florida Navigators, but it's not just DCF that has that. We also have them in DOH. We have navigators at DJJ. We have them in the education system. And Partnership, of course, has our resource navigators. But if we could create, APD also has navigators too, which is the. So if we could create kind of a no wrong door system, because I work with many of the navigators, I don't see them collaborating. Like they don't talk to one another. They don't, like if you come to our navigator and you really need APD, not get directed that. So I see if we could be kind of a connector with all the navigators, work with them so that there could be more cross collaboration.
Okay, in the 24-month area, the county's doing a lot of work on food systems. And so we thought if we could somehow integrate healthy local produce with the county's food systems work, and somehow bring in the school board into making sure that some of that food is getting into the school board for healthy food at the school board level, we could kind of be a coordinator of those services. Or not a coordinator, but a connector, more of a liaison. The trust has identified we need to improve healthy food for kids. To work with the county and the school board. Nancy, did you have your hand up for us? You're on mute. You're on mute.
It was for you, Ken. The threat is to Medicaid, not Medicare. Kids are insured under Medicaid, not Medicare.
Medicaid, yeah, did I say Medicare?
Although there are children who are dual eligibles, because they also have a disability. And
But that's a small percentage. The
Very
majority of the kids who are losing their healthcare access.
I wrote
Well,
down.
I don't know. I don't know if the kids are going to lose it. But pregnant women and children are the largest population that's on Medicaid.
He wrote down the right one. Just. Thank you. What? Good idea. Great.
Okay, let's move to unless anyone had any additional feedback
Anybody?
on health. Anybody had any additional feedback on health? Then let's move to education, or our pillar of Thrive.
All right, so, our little group here, we got a lot of things we want to do. Chicken scratch here. So what we're going to start out doing is our issues, we think that one of the key things that were in the literacy report is parents didn't know how poorly their students were really doing. And I think that's two-pronged. So we're proposing in that 6 months, and this media campaign will really run throughout the whole 6, 12, 24 month, but a media campaign which outreach and inform folks of that this is what we're going to do, where we are and where we'd like to be. And it'll be kind of thematic over the course. So 1 month and to start out like in the first 6 months will be increasing, letting folks know of the resources of pre-K and Head Start to increase participation in that, school attendance, and it'd be like a layered type thing. Then as well as outreach to licensed child care providers and family providers about that. And we want to convene all of as many folks as we can, the school district, ELC, UF, Santa Fe, library, funded providers from CTAC and child care centers so that we can kind of all be coordinated and get these messages out to them as well as the general public, get everybody on board. Those are things we would focus on in 6 months.
So that, could this be part of the summit?
Yes. And then in the 12-month timeframe, at the end of 12 months, we would measure and evaluate, measure the participation in pre-K, Head Start, school attendance, and things of that nature, graduation rate. I shared with Lee, one of my focus in starting and being a school board member was EQ, what I call EQ. All of our students would either be enrolled in post-secondary opportunity after graduation, employed or enlisted in the military. We gotta prepare them for something. So we would continue to try to involve our community through our media campaign, recruiting and retaining volunteers, especially our seniors and retirees, training volunteers. We didn't say this, but I think we should pay people if we could. We would deploy attendance campaigns and competitions in the 6-month timeframe and continue that on, kind of, by school, incentivize it in schools. Yep. We would, in our media campaign, begin to highlight the importance of reading at home and vocabulary development in our youngest learners and continue with promoting school attendance throughout for all of our students. Try to develop a podcast as part of our media campaign, TV ads. All right, see there, we on it. All right. And really hitting all of the, as part of the campaign, really like layering on our communications and a whole lot of modalities, TV, radio, print, and ads on buses and marquees, using the school resources. And then at 24 months, we would look again at our targets. Like I think we'd have goals set for that first school year, and then we'd have a goal set for the second year at the end of 24 months. And we would again look at our EQ, our students who were enrolled in post-secondary, how they're progressing in the, pre-K, Head Start, and K-12, and those that were employed and those that were enlisted in the military.
Very good.
Can I suggest, since so much of this, and I'm hearing different expertise tapped into, whether that's
I had
Yeah.
to totally.
But I think actually resonates.
I would add to that, one thing we know, this idea about the first 5 years, we've all talked about it. We've talked about 20,000 words by the time they enter kindergarten. And Dr. Knopf has recommended, this book about conversation, and every family, no matter their income level, can do conversations around their infants and 1-year-olds and 2-year-olds and 3-year-olds. And that is so empowering when you have families that don't know what to do. If you just say, speak to each other in the presence of your infant and your child, and you are wiring their brain, that's a simple but empowering thought that if we could get into the ethos of all new moms and all kids between 0 and 5, that conversation is so powerful and they just have to observe, listen. I mean, I have a 4-month-old and an 8-month-old, and I knew all this stuff, right? I mean, I know all this stuff, but now since that thought has been in my brain, when I'm holding him and we're talking about our day and he's watching and he's looking, I'm just making that connection of how important that is. So that's something that I think is a very low barrier, doesn't require any funding. It's just education, education, education about the power of conversation. Be quiet. Yes. Stop talking so much. Wouldn't that be great if a 5-year-old came into school and said, stop talking so? Yeah. So that was just something I thought about. I have 2, yeah, I'm a new granddad, 4-month and 8-month.
You thought you had a 4-month and an 8-month?
Oh, no, 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 I don't have a 4-month-old. Well, yeah, they are mine. They're my grandbabies. Robinson strikes again.
Thank you. I think we're gonna move on to safety unless there's anything else. So in the safety, yeah, in the safety group, we were able to, my Post-its aren't ready yet, sorry. Uh, We're addressing childhood trauma, so we started with the META program. And so at the 6-month mark, we're thinking that by then we should be able to identify the experts in our community who would offer the training to providers, offer the training within those sites to the students, train on assessments. We would also want to identify the service provider who we could refer students to after they are assessed. So by that 6-month period, we'd like to see both of those to be very strong. At the 12-month period, by then we should have updated contracts to include language that states if you are receiving funding from the Children's Trust, then you are agreeing to have our experts come in and train you, train your students, train you how to assess, or they will complete assessments with those students. We also, at the 12-month period, will continue our current professional development plan. Many of you all remember the approval of the learning management system that we've been using now for maybe, I don't know if it's 2 years or 1 year at this point, but we could continue to work through our professional development plan and offer continuous support. By the 12-month period, a system of care in place for all things trauma, all things services, all things assessment. So really getting that system of care up and running and having them meet to ensure that that service is running well, and to see an increase in the number of children and youth who are accessing services based on assessments that were needed. I'll stop there before I go into the other activity to see if Dr. Hart and Mia would like to add anything to that.
Nothing to add for me. I think you covered it.
Dr. Hart.
Yeah, one thing we need to recognize is that if we do a lot of screening and we refer a lot of children for a lot of services, our data is going to look worse. Because right now our head is in the sand. We don't know. So we need to be very careful how we message to our community about this. There's no doubt, we all agree it needs to be done, but you have to be really careful how you manage the data.
That's a good point. For the fact that the data may change and show that there is a lot of issue, but also so that families will accept it.
I think there are going to be there could be a little pushback, right?
Mhm.
A lot of pushback.
I mean, I could see that I could see that data being, identified and helped. And as those numbers increase, it's actually a good thing. So it's really all in how you communicate it. Because if we haven't identified, we're not doing the work, to Dr. Hart's point.
Reading the first 6 months.
Do they need to put any provisions?
Yes, I would agree to that. I think we've already started the importance of trauma, why this is important through the series that we currently have. But I love the idea of then starting those conversations with the families.
Can't assess without parental consent. So you can do all the educating you want. That's just part of, especially at the provider level. But once you start talking to children and asking questions about what's going on in their home and in their past, you're going to need parental consent. There will be programs who will tell you they cannot do it, and there will be parents who say you cannot do it. About how to address, but I think we need to be very careful. That allows parents to opt out.
Without penalty, because, that is, I was actually thinking that as well. And just since we've been using ACEs in motion.
Legal advice on that. Yes, I would absolutely do that from somebody who does healthcare law.
Yeah. I think in getting over that barrier of parental contact, I think the meta program model may work because a lot of the programs that we fund do have trusted relationships with their families. Families are more likely to consent and to get help in that environment. And the stronger the trust, the more accepting. And so I bring up ACEs in motion because initially, mental health counsel was coming in just a little while. Kids Count, Girls Place, and AIM were sharing one counselor initially. Cheryl and I know that because we were on United Way, and United Way was funding one provider. But as the level of trust picked up, it wasn't that the needs weren't there, but the level of trust and acceptance and the consent was there. AIM's need, the demand, right? So they ended up getting their own counselor. Until now, there's somebody that we're paying full time. And now it's moved beyond just with the student to be in family counseling. They're doing some family. So
Onion, you peel the layers. Yep.
So
Also looked at out of school time activity. What we hear a lot is that they need something to do. And so we talked about starting at the 6-month period, offering some sort of interest survey in a couple different ways, trying to capture as many students as possible. We talked about the interest survey through our Teens Work Alachua program, through our partnerships with the Education Foundation, through the Sheriff's Office with the Teen Court program, our 3DE program, our after-school programs, all of our programs, right, including our partners, gauging their interests, just things that they may be interested in. We recently learned that there are several youth who are using the library as a hangout spot. Great. They find it to be a safe place to be. And so we need to find ways to support those youth who are there, making sure that they have activities, so on and so forth, because we know the community also wants to use that space. So surveying their interests, bringing some sort of awareness campaign also for the youth. And then at the 12-month period, creating some sort of youth leadership summit that could target our youth councils across the county. And through those youth councils, I find that that could be an opportunity to introduce youth, introduce youth to the youth council in their areas. It's amazing how you grow up in a municipality and you're like, oh, we have a youth council? So it could be introducing them to the youth council, having them potentially join, partake in the activities of that youth council. Mia had a great idea about youth give back. And so they get together, they give back to their community, give back to our county as a whole in many different ways, whether that's volunteering with the younger students, volunteering with the elderly, beautification projects. It could be so many different things. I thought about the Youth Leadership Summit being something that can be done twice a year. We bring youth in, we introduce them to different professions, introduce them to different organizations, other youth who are doing amazing things in our county. And then at the 24-month period, creating a successful teen center, and then teen center hubs throughout our community, because not everyone can get to Gainesville to a designated teen center. But if there are hubs throughout our county, then we could take those services. And we talked about place-based services, right? Bringing the service to where the youth are who may not be able to get there. Any feedback from my other partners? I love group one did their, it was a group approach. Anybody else want to add to this discussion? Go ahead, Dr. Hart.
Christy, we didn't talk about this in our group, but you kind of gave me an idea about the youth counseling programming and locating it in various places throughout the county if people cannot make it into Gainesville. Would our resource centers be a good place to have a teen counseling site? A hub?
Teen counseling site? Is that, I want to make sure I understood
Well,
what your question
what did you call it? I may not be
Oh,
using
the youth council, the youth council. It's definitely, it could be a good start. I don't see why it wouldn't be. It could be a good start for sure. Yep.
And there are libraries in every city.
Goal 4 will report out. And
I'm
we
the only one who can read my own writing.
see this one.
So we broke it up into two areas. One is actual capacity building in the way that we were talking about it with the Teresa, and then also the meta programming and how we kind of track that. So for 6 months, we had that we would develop a selfie strategy for how to roll out the selfie to all of our providers eventually, so that we could kind of really have a solid understanding of where they are in the developmental process. And then also because we are contracted with CNE to see how much utilization there actually is. So we're collecting baseline data basically to see how many of them are active, in what kinds of programming, so that we have a sense of how it's being utilized by the folks. And then for 12 months under capacity, we actually would have an expectation that, I had my colors backwards, wait a minute. 50% would have completed a selfie, and 20% would have an action plan that said, this is how we plan to move from the stage we're in now to the next stage, focusing obviously particularly on looking at folks that are in startup, have a plan. And then at the end, and also we would want a percentage, we threw out 50% because we really have no idea what the baseline is right now for utilization of CNE and to what degree. So we want to collect the baseline, and then we'll need to figure out a better percentage for that. And then at 24 months, we want 90% having completed a selfie, 50% with a plan, and 25% again having moved up a stage. And obviously with folks that come out of maturity, what we want is for them not to go into the declines. Yeah, right. Yeah.
Or to be in that regeneration curve as opposed to they're not be in the decline. They can be in maturity at the peak, but we don't want them in the decline unless they're in a turnaround. And then 90% effectively using our CNE training opportunities.
Then for the meta programs, again, I think we need to collect baseline data from our current programs. And we talked about the meta programs as having three parts. One is training, getting the training. The other is implementing the training, either doing the work yourself or, like Christie's group said, bringing in someone to help put that into your program. And then last is actually measuring whether or not it's had a beneficial impact in what you're doing. So initially, we're just, again, we need to collect baseline because we have no idea how many of our providers are really effectively using either the training we provide or something else to supplement what their expertise is in-house. And so we want to assess awareness too of what's available. Do you know that we offer you training on X, Y, or Z? Or do you know that there are other organizations in the community that can help you support or identify best practices? At 12 months, then we want to actually have, and this is going to have to be staff work again, depending on the baseline, have targets set for the training, implementing, and showing benefit categories. And again, at 24 months, that we want 90% of our providers, I can't read my writing either, aware of and utilizing resources for the meta programming, either through the trust or through other community partners, and 85% at least implementing, 85% implementing, and at least 50% able to show that there's impact from those meta practices.
Any feedback additions?
A percentage to be set of the organizations that are training, implementing, or showing benefit. Without baseline data, it's hard to say, what kind of a percent.
Any feedback or additions or modifications from anyone? Outstanding. I think that visioning really worked. That's a great set of activities. Hopefully Marcia and Christy and the team feel energized by all this baseline and these summits that are happening and making things really enriching the safety. So, I lost it, huh? Let's take a quick break. Can we make it 5 minutes this time? Because we do need to talk funding.
There you go, Lee. We're going to talk money.
Like money.
They said 10, so 10 minutes.
I'm gonna try to wrap up by 4. Okay, we're gonna be wrapping up at like in an hour, so at 4 at the latest, so I don't know, just could get wrapped up. Let's do that, that way you can keep Angel home. Okay, so he'll be, what time do they close? They don't close like at 4. Cause I'm right here.
But yeah, I got one of those.
Always so funny. I get asked every once in a while, I'll still get text emails from somebody at Meridian going,
But it's true because once the historians walk out, I was looking at some of my old email in my archives from the nineties and, you know, cause it's still in there and nobody will know that stuff after you leave. It's just,
nope.
their perspective is from where they started till, you know. My son is now 5 years in DC. He works in the fraud investigation side. So different world, but he started in economic services and I bequeathed him some of my old files. Because I'm like, nobody else will have this history. I don't want to throw it away.
Yeah.
Just put it in the closet somewhere, but at some point it
I
will
left
be.
a set of binders that were kind of like,
Yeah.
well, and there are things like, you know, central receiving facility. I had folders in my office that went back to like 2013 when we started talking central receiving. And I sort of bequeathed them when I left. You know?
Because at some point they may pick it up and.
Yeah, well, it finally got done and thanks to the county.
What's
I
that?
was just saying, before I left, I had bequeathed all these 2013, 2012 folders that were at the beginning of Marina Chiquini. Remember Marina from Vista and I talking about a central receiving facility and
Yep.
she and I had spent literally 10 years before that talking
Becky,
about the idea of a site ED.
Can't throw away that kind of.
How is that working?
As far as I know, really well, but you know, I haven't really touched base with it. My husband's now on their board.
That's
Your husband's on the board?
Uh-huh. He's great. I mean, he's a former CEO of another mental health center, so he kind of knows, and he'll be great for Lauren because like he knows what it's like to sit in her chair. You always need a board member who knows that.
I've still got old Esther files that I just couldn't throw away because I couldn't. Like some of the, when they were first developing the library partnership, throw that stuff away.
I embarrass Esther sometimes by saying how grateful I am to having had her in that when I was
She
coming
was
up.
so amazing. She used to scare the heck out of me.
Oh, yeah,
when I
she
was-
scared the hell out of you. She did.
But-
When I would get a call on a Friday from Esther, it was like, oh shit,
I know,
what'd I do?
I know. But she was
Get her
just,
color-coded memos.
she was amazing though. Like she knew her business like nobody else.
Still is.
I know.
We had fun because I was the chair of the community foundation board up until last year and she took over and I followed in your footsteps.
Yeah, yeah. She's so good.
She's
More than 300.
Still is.
Have the ability to have some flexibility on special needs and other things.
I remember when I started, she was the deputy district administrator under Suzanne Casey. Yeah.
Move right.
Yeah.
So I got to meet Esther the first time when she was
Move
coming.
right in.
We were having safety issues out in the Levy County office. And she had.
I recall Yours was the only one that was worse.
And so I remember meeting Esther that first time and she was, okay. So
All right, let's go ahead and reconvene. We are working towards 3:30, 3:45 with a 4 o'clock hard stop.
Yes, we will be there. All right, so let's move to the next slide, please.
Slide 15 of 18.
That shouldn't take long at all.
Okay. We mentioned earlier that we wanted to take a look at the funding levels and talk about whether they were in the needed to be increased, decreased, if they needed to shift it any at all. We have made some changes in each of the goal areas. You guys have talked about some of their focus areas of focus changing. As a result of that, we know some of the indicators are going to change, and we're not going to talk much about the indicators now because we have had those changes. And so that's something that we're going to have to, staff is going to have to come back and take a look at and bring back. However, there was a question when we spoke with you about what's important in you allocating your funds. And we gave you a list of considerations. How important is? Remember that question? And here is what you said. Here's the results. Here's what we heard. The two top areas of importance for this board was impact and leadership. Consideration of impact and leadership when we're distributing funds. Close to that was collaboration and partnerships and sustainability. So top two, impact, leadership. Next in line, very close, still in the fours, partnership, collaboration, and sustainability. And then impartial distribution, which we talked about equity. That was the equity question. And expansion were important, but not as important as those top four.
Yeah.
Yes.
The question, how are we defining leadership?
I knew I was going to get that question. We're defining leadership when we talk about your providers, the leadership of your providers, the leadership of your internal, so that would be you guys as well. But primarily when you're allocating funds, we're really talking about the leadership of your providers. I think you said that has to be a consideration when you're doing.
That rings true for me, Marcia, when I heard someone earlier today say, oh, I love the trust. And then they start talking about a program. They connect the programs with the trusts. And like Lee said earlier, we will live and die by our programs.
So there you have it when allocating funding. Next. Did you get a good look at that? Okay. Okay. So let's talk about that for a minute. Let's have some discussion on that. Right now you have 50% of your allocation in health, 35% in education, 10 in safety, and 5 in your new goal of capacity. Made some changes. Want to have time to digest that and come up with some recommendations, or do you want to have some open discussion now about what you're thinking and then come back? Let's hear from you. What are your thoughts now?
Good now. No one here is afraid. Let's do Lee and then Maggie. Right. Dr. Lauren.
So my challenge with figuring out the allocation is I don't think we have programs in the bin that they're ultimately going to fall into, right? So I don't know how much we're actually currently funding in each of these categories. And I think in my mind, it feels too abstract to just say this percentage here and this percentage there without knowing where we're starting from. I mean, it sort of makes sense in this, the structure in terms of cost, healthcare, whatever we're going to do healthcare wise probably is more expensive than some of the other things we're going to do just because healthcare is more expensive but I don't know, and I think that to Nancy's point, safety is way 10%, given what we're dealing with in terms of gun violence and trauma and all the things that we're trying to talk about doing. So I think there's gonna have to be some reallocation, but before I commit to a number, I'd like to just see where things are now properly placed in bins.
So projected budget for you in here?
Right, but a lot of the out-of-school programs.
What page is that? Oh, yeah, but she's questioning the classification of that funding.
Right, so unless we've redone it and I just didn't.
No, we
Okay.
haven't redone it.
Yeah,
But
so unless I know if a program is not providing academic supports and out of school time, then maybe they are just in safety, providing a good, safe place to be after school. Whereas if a program is really focused on academic achievement, or at least in significant portion, and some of them may fall into several, right? I'm thinking, God, Tina, ACEs in Motion, that's providing mental health care as well as tutoring or support for academic goals, as well as a safe place. And unless I know where the current programs are, I have a hard time jiggering the money.
So what you would like from us is for us to bring this back with that information by program for you.
Right.
Is that what I hear you say?
Yes, putting them in the goal areas based on what they're actually delivering. So again, ACEs, just to keep the example of ACEs, they're falling in 3 categories at this point for me. Falling in.
So you would allocate their funding.
I would put their funding into 3 different.
So it's an internal spreadsheet thing.
I gotcha.
Yeah, so that
where
we can.
Staff says, okay, ACEs.
What we're currently, not how we're currently funding them.
No.
Maggie's saying is staff knows what ACEs does. And if it falls into these 3 categories, let's make a judgment of how much we're funding and allocate that using our best efforts, and then bring that back to the board so that it's not an all or nothing in a funding source based on the program. Is that what you're saying? And then from there, we can then see,
What percentages?
I mean, I have an opinion about percentages.
Being close to 50.
It may, but it may not, you know?
Well, and I know when we did the original strategic plan, the reason category 1 was more was because we combined 2 categories.
Correct.
And so that was, we put funding between 2 categories into 1 category.
On the last day, and the last hour of the last day.
Yeah.
And our partners were like, what the hell? And I was like, welcome to Alachua County. Yeah. I have some, I'll let my colleagues go.
Mine was along.
Okay.
Percent may be the correct. How they were
Their
grouped. Silos, so. Number 2 may actually not be as askew as it currently appears to be. So let's get that information, then we can, if we do in fact want to change.
And jointly with that for me is making sure that we go back to not what we contracted for, but back to that discussion we had at the last board meeting, because if we're not expending all the dollars we're contracting, again, it may not be as overspent as we think.
Tina, do you have?
I don't
Out of
know that-
whack.
I don't know that I agree with you on that, because we've got to have something, and this is what they asked for,
Right.
so.
But if they've asked for the same amount for 3 years and never actually drawn that amount down, that's not really what we're spending in that category.
But that's to me, Maggie, for discussion, that is, we need to see by internally, and then then we'll use those numbers. But until then, we make a budget.
That's fine with that.
So I want to be clear so that we make sure we're bringing back what you want.
Hold on, let's
Okay.
hear from everybody and then we'll collectively decide on what we want. Tina?
So I'm not for like changing the percentages partly because of what Maggie says and that, but I also wonder if we need to be earmarking an exact percentage for each of the goals. If we couldn't just say we're funding goal, because to me, it makes these goals compete with each other.
But they are.
Right, okay, but then it could be, if health is more expensive, and we want to address health, and we're addressing health, it may, just because of the way the cost of it, it may end up rising up to the top, number one, because it costs more. And I don't know, I don't feel like I have enough info on where we are with our exact, with the programs now, giving the additional information that we have in the discussion we've had as a board, and us saying that several programs we know cross over multiple, buckets. Before we say we're over allocated in one goal or another, we really should look at where, like, have staff reallocate them and bring it back. Then I would feel like I could change. Right now, I'm not for like changing the percentages based on the conversation we've had, right?
Okay, thank you. Mary?
And another factor, when we were going through the 6, 12, and 24-month categories, a lot of the things I heard in education were about a communications campaign. That's a different cost basis than a doula or a visiting RN. So it doesn't mean you don't put as much like weight on it, but like what we do may be more macro than micro, and maybe more touch level, if that makes any sense. So that's another factor to consider. Also with safety, I mean, there's other players with safety, so the role of the trust might be different, like leveraging youth voices in safety and gun violence.
Talked about that.
As opposed to what law enforcement, other people's roles are. So it seems to me that programmatically, we've taken a more hands-on approach to health versus some of the other categories. So if that continues, that should be factored in. Like, what is our role within those buckets?
And some of that may be one time.
Okay, Dr. Hart, do you have an opinion on this?
Yeah, well, it's really hard for me to unpack my interest and commitment in safety for all children and youth versus health and education, because I feel like they're all knitted together rather tightly. And I guess I'd be really interested to know to what extent staff think a health program is also a safety program. And I really don't think we're spending enough money on safety. I think it's too important to getting health and education started right and reducing violence in teenagers and older children. It's not the 0 to 5-year-olds who are committing violent acts. So I'm sorry, it's not a very good answer.
No, it's a great answer. Thank you, Shil. Okay, so I'm gonna be the outlier here because I'm more with Dr. Hart. I think the purpose of the plan is to identify the priorities and then fund them. I very much want the information that Maggie has requested, and it may change kind of where I come out, but I am ready to actually make changes to the percentages, which again are guidelines. They're not hard and fast rules. They're guidelines for us to think about as we're developing our budget. From my perspective, from this one member's perspective, I am really, really, really focused on literacy in the next 3 years. And I'm really, really focused on Dr. Hart's point about trauma. And so my numbers are 35% on health, 40% on literacy, so increasing that, or increasing education, 20% on safety, doubling it, and actually spending it on the things that are not currently in our plan, but some of the things that we've been talking about from a meta perspective. And then capacity kind of falls out at 5, not because it's less important from my perspective, but because it's new and I want to ramp that up. The presentation that Teresa gave this morning was, amazing for me. And if our staff takes our 80 programs and puts them into categories of startup, growth, mature, and then identifies of the 4 legs, where are they each lacking, and can then bring that information back to us for the next budget cycle and say, if we really focus on this leg of the school with startups and this leg of the stool with growth, we could move the dial, then I'm ready to increase the percentages there. And I think that's probably what they're planning to do at some point. But my numbers are 35, 40, 20, and 5. And I don't think we need to make that decision today because I think the majority is, they want more information. So I just kind of
What did you say? I could deal with that.
35, 40, 20, and 5.
Yeah, we can set a number, but we're gonna have to come back and revisit it, so and I agree that it seems a little bit out of whack right now, and that safety, particularly given the emphasis on trauma, I think is way underfunded, but I just don't know where our programs are gonna fall out, and that might help us make that percentage a little more precise, or not.
Yeah, I mean, we allocated a big chunk of money to mentoring last year in the
Right.
safety category and didn't
And
spend
gun
it.
violence.
And gun violence and then didn't spend it. So we've said it's important, but we're not sure where to go. And I keep going back to what slide was it where we had the 6, 12, 24-month Nancy Hart, that slide?
Yeah.
Like this board has, it's, I don't know if she heard that.
I don't know if she knew, I don't know
Probably
if she
doesn't get
I don't
it.
know
She
if she
didn't see it. Yeah.
Yeah, I mean, this board has so much expertise in different areas and for our folks that are helping us, before the Board of County Commissioners formed that dependent council, which then led to the independent ballot council. This all started with heat maps of child abuse and infant mortality, and then poverty and crime. And those heat maps were developed by Dr. Hart. And so that's a little bit of the history of, she's been talking about this for multiple decades. She's been educating our community for a decade, and she's been educating us for 6 years.
Another funding issue for me, if I can, is I think that it would be helpful if we could come to some consensus and maybe a policy around, talked about the fund balance, we keep talking about needing to deal with that. If I'm correct and our actual expenditures are a lot lower than what we budget, there will be. So I think we need to understand what we think is appropriate to fund out of fund balance. And I'm thinking, so we talked already about the gun violence task force, that initiative. Not a program per se, it's really an exploratory process, that's an appropriate use because it's not.
I think our new categories are an appropriate use.
The new category, because again, once we've got most of our providers on selfies, you're not gonna need, so I think that we ought to also distinguish what we want to use, how we want to use fund balance. And I think some of these, perhaps the stuff that we're contributing to the Lansiger project that came out of that evaluation would be a good use of fund balance, because again, it's a planning process, not a program, rather than trying to that. And then the other thing is, we all agreed, it was, I think, number about not my word for it, not funding from the podium.
I have a policy for that.
And I think that we need to impose on some discipline on ourselves around what kinds of things we fund out of recurring dollars, what kinds of things we fund out, how we accept funding requests, and it should never be from my opinion.
Thank you, Mr. Chair. I would recommend that any request for budgeting or funding go through staff first, and staff would bring it.
Take the policy that you all already approved and we can update it and bring it to your August meeting. How about that?
I like that. Does everybody agree with that? Any objection to that? Okay, and what I've also heard, Marcia, is asking staff to identify the existing budget, take their best shot at which category does it fall in, and create an internal that allocates that money. And also look at that funding from the standpoint of recurring versus one time. Tags with maybe a different color or a little footnote, so
What
that
we consider.
what you consider.
Okay.
Brought up the spending of fund balance. As you know, in this year's budget, was no fund balance per se, because
But we will know, we'll have.
we'll have an idea, but they haven't,
That's true.
they will not have the final balance.
This is
Because our budget was for over $13 million.
Right,
Yeah, but again, this whole discussion is about the 26-27 budget.
right. It's not for this upcoming year. Our current strategic plan will cover us through 26, right?
Not factor into our August and September.
Correct. It
But
will
by
be-
the end, by the time that's done, we'll know,
Right.
we'll have an
Right.
accurate fund balance whenever the audit is complete.
Right,
And then what we need to do is commit to not.
Right.
not spending from the podium. Ms. Jackie,
And you summed that up nicely, but I need you to repeat it, please.
need me to repeat it?
What you just
Yeah,
said.
so I think without
You're gonna
objection,
Identify the existing budget.
oh, for the existing budget, yeah, the staff is going to take the existing budget. They're going to take their best estimate of which of the categories the funding falls under, recognizing that some programs may fall under multiple categories, meaning health, education, safety. They're gonna, create a spreadsheet that shows those totals so that we can see if we are at least close to existing levels in our strategic plan. And then of those funding amounts, they're gonna identify from their perspective, what could be classified as ongoing and recurring versus potentially one-time funding. So that when we get to how we're allocating this use of fund balance, which right now, by the way, we're allocating fund balance for program. Right, that we can understand where that is. Christie.
Just a point of clarification, when we are generating the report for you, identifying which program goes under which goal, you all want us to base that solely on what we are funding them for, right? Because there are some programs that may be known to do something else, but that has nothing to do with our pot of money.
Correct. Our
Okay,
money, what we're funding.
that answer, that, okay, all right, thank you.
Yeah, and I suspect that this exercise will result in, 5 or 6 staff members, and you're arguing and debating about why it's this and that. To the extent it's helpful to provide, here's why we came up with that allocation, here's 2 sentences. Make a footnote, give us homework, we'll look at it. And again, these are guidelines, not hard and fast, so, because we're trying to overcome the weakness that says remain aligned with the agency's scope of work. And adherence to the strategic plan.
Strategic plan.
This is a weakness we are working on, yeah. Okay, Jackie, back to you.
Okay, great. So we're wrapping it up. We have looked at our goals. We have made some adjustments to those. We have prioritized our areas of focus, made some adjustments to those. We did not do the core indicators simply because we made enough changes within the goals and the areas of focus that your core indicators, some of them are going to automatically change. So staff needs to take a look at where we are and come back and recommend some core indicators to you, and you can have discussions around that. We talked about funding, but we have an assignment on funding as well to identify the existing budget, best estimate the categories, recognizing that some of them fall in multiple categories. Create a spreadsheet that shows the total and identify ongoing versus reoccurring, occurring versus a one-time thing. Some of the other next steps, that we are looking at, that we just talked about core indicators. We need to, once we get the core indicators, the goals are set, the areas of focus are set, identify timelines and owners, especially for those 6-month, 12-month, 24-month efforts that you just put up, okay? So that's yet to be done. We want to take a couple of minutes right now and revisit the mission, because you mentioned early on, but we didn't do it. You said take out all in your mission. Do you want to take the word out, all, in your mission?
The mission says the Children's Trust of Alachua County funds and supports a coordinated system of community services that allows all youth and their families to thrive.
You want to take out all? No.
That was a really important piece of messaging advice that we got when we created the
Was.
trust.
And it's
it
also
was-
in the statute that
Okay.
when you provide services, they must be provided to all. They doesn't mean all will participate, but they must be available.
Okay, all right. So we know.
Take the all out.
Yes.
We did that. We also mentioned at one point to take it out of the mission.
So all is in the mission and the vision statement.
Right.
It's not in the vision, is it? It's in the.
Yeah, the vision.
It is in the
facilitate
vision.
Equitable access.
Facilitate equitable access and opportunities for all children, youth,
Yes.
and families in
Okay.
Alachua County.
So it will stay in the mission and the vision.
I
We
mean,
took it out
that's,
of that.
to me, that's really not a vision statement. It's not a vision statement. I mean, it's really not. I mean, if you really wanted to have a vision statement, it's that every child in Alachua County reaches their maximum potential. That's a vision.
You want to revisit the vision?
Robinson, I saw you agreeing. Stand up. Come on.
He's right.
Yeah.
We've got plenty of time. We changed shit up till the last minute on this board. Help us focus that statement.
It says, facilitate our vision is to
Facilitate equitable access and opportunities for all children, youth, and families in Alachua County to ensure every child reaches their maximum potential. So that is the vision. So a vision, as Dr. Labarda just spoke, is if you close your eyes, I can envision a day when all. So the vision would, you could take the same, meaning from this and say, I envision
But all children, youth, and families in Alachua County.
families in Alachua County
reach their maximum potential. Reach their
Reach their maximum
All
potential.
children, youth, and families in Alachua County reach their maximum potential.
Yep.
all children, youth, and families in Alachua County
Reach.
reach maximum potential.
Love it.
In the last 5 minutes, you tell me.
Love it. Does anybody object to changing that?
And that's the difference in doing something at the end of the day and the beginning. That vision statement took forever in the other one.
Because I think there were like 20,000 wordsmiths.
That's amazing.
Thank you, Ms. Robinson. Okay, good.
Dr. May.
Florida, yeah.
We have a new vision.
Before we move on from so
Want to finish up this, the priorities that we talked about that were in the triangle. We've got to figure out what we're gonna do with those, with staff. We can talk about that with, staff can discuss it and we can help you if you like.
You're talking about those additional ones.
Yes, the additional ones. And then, so that's why we said work with the internal team on, as many of these as you would like. And am I missing anything?
You're not missing because it wasn't on you. But and I probably should have brought this up when we were having the discussion. Outline the different phases. And I think that, we've discussed this at times and never really come to any how much the trust should be spending on somebody's budget. I would think that there should be some correlation between where they are in the development state and how much we spend. So, startup, it may be 100%, and that's why it goes to the point, where are they in the scale, and it back for 3 years and they're still asking for us to fund, then they're not really growing.
That's why we put one of the objectives is that when they retake selfie, they will have shown those
Right.
stages so that then, yes, we should.
So another thing I would ask is that staff come up harder policy, as far as percentage or how much of a budget should we realistically expect, to fund.
Yeah, so I hear you. I feel like this was a great step one. I think staff needs to process, synthesize rather, pull it all together, and then we come back for workshop two. Workshop two, you see all of this, right? And then we begin that conversation.
Perfect. That's.
Yeah, I think that's fine.
Conversation.
Yeah.
So that's-
Yeah, and I think what also would be good, Marcia, if staff has this information, is when you're bringing back the allocation by priorities, it would be helpful to know of the amounts that we're funding these organizations, what percentage of their budget is that? What percentage of their budget is that
Trust
funding,
money.
is the trust funding?
Which will sort of give us a rough
Yeah,
estimate of
it's a-
startup
So
versus.
we're not having a policy yet, but we're identifying information
Right.
that could lead to a policy.
For this year. Yeah. They have other sources. Okay, I know we started asking that question during this fiscal year, so that shouldn't be an issue.
And that all plays into this guiding principle number 8. And you can look at that a lot of different ways, that we reward efficiencies, take advantage of economies of scale, and maximize services. So, I mean, that's a lot. So thinking about that through the life cycle lens and also the category of whatever we're going to call the innovation startup grant threshold versus the deeper investment threshold, that's a lot to chew on.
And it will help us know, I mean, I think it's gonna give a rough estimate. So if we know that in goal 1, 80% of the funding that we're allocating is to people for 100% of their funding, that gives us a guesstimate that they may be startups. Guesstimate.
Yeah, before.
They do the selfie.
Anything else, Ms. Jackie?
So one thing that I want to bring to light is you had two goals that we kind of put together in that triangular where we're growing partnerships and collaborations and funders to collaborate. That's going to be a heavy lift, and it will probably require a lot of board members as well to really move that ball, because that's going to maximize your dollars. And that might be one of those things that you'll want to pick up on your second retreat or second planning, because that's a heavy lift when we're talking about all the educational institutions, the school board, et cetera, really truly partnering that you're maximizing. I think that that's going to be one of those heavy lifts that we didn't get to today.
Probably a 6-monther.
I heard that, I was like. Because
It may not even be a 24-month.
Yeah, we're partially doing it. We're meeting with, this board meets with those boards. Well, except for the educational.
Yeah,
That's a big.
But Cheryl pointed out a sad reality that these agencies who do referrals don't talk to each other. And so it's like a
Navigators.
cultural.
Yeah, I think,
thing.
I think that may not be one group. I think it's collaboration for what? So there may be collaboration around health, collaboration around education. I don't think they're all necessarily.
I mean, that was a dual comment. One was a navigator comment, but one was really, what are we funding? And where can we gather more leverage based on what each of us are funding? Ms. Roberts.
Yeah, I just want to confirm something. So I think this is great conversation. The good thing here, and tell me if this is true, is the current strategic plan goes through September 30th of 2026, right? So the things that we are talking about here begin October 1st, 2026, right? Because there are quite a few things. I heard 2 symposiums. I heard, I think we got to bring all 85 or whatever providers in a room and share with them the new agency. So
I mean, that's.
Continue to do the work, right?
That's true and that's not true. So that's true, but the budget for that year starts 6 months from now.
oh, so it starts January.
So we start the budgeting process, and staff will be bringing us a draft budget
So
10 months from now. So in May. Yeah, and so that's where we're gonna be pushing for what are those allocations based on our strategic plan for.
And that was, so my question was, when must this be complete? So that's what, so everything that we are doing together once we leave this room and our second session, and then the finalization of this plan for 2027 through 2030 or whatever that number, that needs to be finished then by the end of the first quarter or so. So,
March, April. Yeah, March, April.
okay, thank you. That was so that the team understands that as we begin to work backwards. Thank you.
Okay. That's it for us. Unless you have any further discussion, we have our next steps.
All right, this is.
We'd like to do a checkout, and Regine loves to do this, the quiet one.
So I just like to check out and see how everybody feels about what the work you've done today. What the feelings. And if you don't mind, because we have been so honored to see so many staff, we don't often see that. Do you mind if I start with the staff and ask them to check out? You spent the day with us. Thank you. And I'd just like to ask, how do you feel about all the work that's gone in with your board and your leadership today? And that's one word. Tell me in one word how you feel. Anyone can start, but everybody gets a turn. Give you the mic. I guess I'm passing it to you, but.
Bonnie say?
I'm a thinker. I mean, I think really hopeful and excited. Like I like.
I like hopeful. I'm excited.
We're trying to go one word. I lovely. I think maybe optimistic.
Yeah.
Well, Bonnie took mine, but I would say hopeful.
Save your whole bunch of work.
Feel like a thesaurus right now, but I'll say positive.
Okay, I guess since I'm the newest addition, I'll say eager.
I like it. I'll let you go last. Tina, would you like to? Keep going with staff. Oh, I'm sorry. Christy.
A couple over here.
Okay.
Social workers rock.
Thank you.
I'd say,
Okay, thank you.
I feel like
How do you spell that?
To use the slang, I.
no, but invested.
I would say the word I would describe this as being, I would say progressive. Progressive.
Yeah. Excited.
All right.
Yeah, this is good stuff. Grateful.
Grateful.
Fun.
Okay.
Sorry.
My favorite words.
Directed. Much more directed, so.
Grateful is my word.
Grateful.
I think y'all did an absolutely fantastic job. Y'all were great. And the word I would use was intrigued.
Intrigued.
I don't want to think
So many words, I know, but I'm gonna say focused.
Oh, yeah. So for the record, nothing, social workers might rock, but accountants make it all happen. All right.
Never call my.
So, I was gonna say progressing or progressive because we've come a long way.
Dr. Hart?
I'm relieved because I thought there might be a big fight and there wasn't. It just goes to show our consultants that we really do get along pretty well as a board.
Absolutely. Well, thank you all. Yes. Yes.
I just want to share with the board something that you all said to me. Um, you all, obviously, you see they are rock stars, and they've worked with a couple of our sister CSEs, and then, of course, all of us, all the EDs, in fact. And they said to me this morning that we are very lucky to have all of you. And I say it to staff all the time that when I sit on those calls and I hear what some of my peers say, I am always very grateful to be in this county. But I really appreciated you all's feedback this morning because that's what I feel and what I knew. And then you co-signed on it. So I just wanted this board to know just how special you all are and to say thank you.
So let me tell you this. What you guys say, honestly, I serving as a school board member, I don't know about Ken when he goes to the FAC meetings, but our county, like it is two different counties, haves and have-nots. But overall, my colleagues actually say, man, you live in Alachua County, y'all lucky. We have to fight to get any kind of assessment going. And your people willingly vote for things except roads. But we finally got roads passed. So really, we really do live in a special community of people with all of its ills. We still live in a community that really does invest in itself.
Amen. Okay, so before we get to the end of the meeting where I'm gonna do a wraparound, see if there's any further comments. This is a public meeting, so are there any general public comments from the community that they want to address this board? Now would be the time. Yeah, feel free to come up to the podium and.
Oh, no, sorry, Lindbergh. No, just thanks for letting me come to work with you guys today. It's really brilliant to see the magic happen in like the behind the scenes stuff that you do, from prioritizing childhood trauma and putting families with children with special needs and disabilities in the forefront. I think you're just really closing even more gaps that you already cover. So that's really cool to watch. You're probably like, why is this random person here? And she's been coming to meetings for a few months. I am newer to town and I work in the corporate world for a learning company. I do not represent them when I come here. I'm just a person. But I also had nonprofit backgrounds. I worked at HMH. I work at HMH. I don't know if that rings a bell. So yeah, it's just cool to see this is the synergy of policy and helping people. So thank you for everything you do, and I look forward to coming to more meetings.
Board members, this is why Alachua County is an amazing place. Ori has attended a City of Alachua meeting with a joint county commission meeting, CTAC meeting, library governing board meeting. I've also seen you at a Gainesville City Commission. And she is an amazing advocate and human, and she's what makes Alachua County so special. So thank you for participating. All right, is there anyone else from the public before we wrap around? And before I go to all the board members, I want to do the same thing that our social worker did, which is staff. I want to thank you all. Your work didn't stop today. All that stuff that you didn't get to today for being here. It's really important that you were here, and it's very much appreciated. It's why my word was grateful. Is there anything that any of y'all want to tell this board that you're going to be dying to tell Marcia tomorrow morning that you wish we would hear? Because your input's important, and if there is, we'd love to hear it. No? Okay.
You should have said. I didn't say that.
Okay, no. Yeah, well, no problem. It's just one of the things that that we always do is we ask for board member feedback. One thing that came out in at least my personal meeting and also as I kind of learned is how important our staff is to our input. So just want to give that space for y'all. Okay, so before we go around the room, Dr. Hart, we're gonna start with you. Got anything for us?
No.
All right. Tina? Maggie?
Yeah, the reason I said grateful is because just the board has really come, I said it sort of, we've come a long way, baby, but we really have, in terms of just working together, having fun together as we really do some serious.
I just want to thank the staff as well because we give you a lot of work and you put up with us. So thank you for that because we do appreciate you.
Mary?
And it's just a suggestion. Wonder if to hold us. Backed into a corner. That's it. They don't understand the process. Ourselves account. Hard to do when somebody's.
I'm used to it, but you're right. Lee?
Honestly, visioning and all that kind of stuff. Not really my forte, and I wasn't looking forward to today, and y'all made it, I feel like it was really worthwhile. All, y'all just all y'all do, you work hard for us. We deprived you of a day to work today, so y'all are what makes it happen. On a lighter note, we have performance measures for everybody else. We need performance measures. Everybody violates whatever we come up strategic plan. I want to know what the penalty for violation is. Like whoever does it has to furnish dinner for a year.
How about bring us blueberries, please? There you go.
Okay, you get that anyway, so don't make that. Oh, okay, make that, then I can violate it. Thank you, Ken. You ran a great meeting today. Thank you.
Okay, thank you. So Regina and Jackie, amazing job. I mean, really, really amazing job. Not only in the one-on-ones, but today, there's a lot of cats to wrangle and you kept us moving, you kept us focused. I, like Lee, I always walk into these things and I think, first of all, what am I gonna be doing all day? How is this gonna work? But it's, this board is so amazing and our staff is so amazing that I've learned so much just listening to them. So thank you for that. And Ms. Robinson, man, I'm just gonna read what's on your thing. Driving exceptional results. That's what you are doing. Thank you for your work. I can't wait to see the next round and really appreciate you and your team. Marcia knows how to pick them, and thanks for leaning in to this community. It's really important. We appreciate it. All right, let's give them a round of applause and then we will call this meeting.